being with us virtually for this meeting of the Capital Area Architectural and Planning Board. I now call this meeting of the CAP Board to order. My mask is it's a little tight here, y'all. Just a second. I'm in a room with other people, which is why I am masked up right now. If you are also in a room with other people, I would encourage you to do the same. So as the chair of the CAP Board, I have determined that an in-person meeting was not practical because of the current health pandemic and ongoing peacetime emergency declared under Chapter 12 of Minnesota statutes. As is permitted under the open meeting law in these conditions, this meeting of the Capital Area Architectural and Planning Board is being conducted over virtual video call, and votes will be counted by roll call. Members of the public can view this meeting via live stream on the CAP Board's YouTube channel, and a recording of the meeting will be posted at that site following today's meeting. Like all our meetings since the pandemic has started, we'll begin by determining if a quorum is present by conducting a roll call. Board members, after you say your name, please unmute your microphone, indicate that you are present, and then mute your microphone again. We will move alphabetically by last name. Dr. Kate Bean.
Present.
Alicia Belton.
Present.
Representative Dean.
Present.
Elaine Fink.
Present.
Don Grundhauser.
Present.
Representative Hertas.
Representative Hertas present.
Ted Lentz.
Present.
James McLean.
Present.
Senator Nelson.
Senator Nelson present.
Senator Pappas.
Present.
Daniel Yang.
Present.
Thank you. A quorum is present. I'd also like to have our architectural advisors, CAP Board staff, and CAP Board counsel introduce themselves now briefly so that we can make sure that members of the public know the incredible team who supports our work. Architectural advisors, CAP Board staff, and then our Attorney General's representative, please feel free to unmute your mic, introduce yourself to the board, and then mute your mic again.
I can go first. Danita Lemon, architectural advisor.
Michael Bjornberg, architectural advisor.
Tony Chevalier could not be with us today.
Paul Mandel, Executive Secretary for the Capital Area Planning Board.
Peter Musty, Principal Planner and Zoning Administrator for the Capital Area. I'm going to also introduce Linda Spohr, who is a planner for the CAP Board, and she is working with technology and may not be able to speak.
Thanks, Pete.
This is Christy Eller, and I'm a Special Attorney Advisor with the Attorney General's Office, representing the CAP Board.
Wonderful. Thank you so much. It's good to see everybody today, and I'm glad that you've been able to join us for this important conversation. Before we dive into the Bethesda discussion, we need to address the minutes from our last board meeting on November 13th. Those minutes were in the packet that you received last week. Are there any edits to the minutes of the November 13th meeting? And I'd ask you to raise your hand if you have any edits. Seeing none, I will ask for a motion to approve the meeting minutes from November 13th. Is there a motion?
So moved, Madam Chair.
Thank you, Representative Dean. Is there a second?
I'll second the motion.
Thank you, Mr. Lentz. Motion seconded. Now we'll do an alphabetical roll call vote on the motion to approve the minutes from our November 13th meeting. Dr. Bean.
Aye.
Alicia Belton.
Aye.
Representative Dean.
Aye.
Elaine Fink.
Aye.
Don Grundhauser.
Aye.
Representative Hertas.
Aye.
Ted Lentz.
Aye.
James McLean.
Aye.
Senator Nelson.
Aye.
Senator Pappas.
Aye.
Daniel Yang.
Aye.
And I vote aye as well. Motion is approved and the November 13th meeting minutes are confirmed. Thank you. So the main topic of the conversation today is the co-application from Ramsey County and M Health Fairview for a variance and conditional use permit to use the Bethesda Hospital building as a temporary shelter space over the next 18 months. As you recall, we used our meeting in November to hear from the co-applicants about details of the proposal and from members of the community about their input on the proposal. It was an important conversation that we started, and in the month since, CAP board staff have continued to meet with the co-applicants and members of the community to discuss updates on the proposals and to have important conversations about potential elements of the conditional use permit. I want to thank, I am just so moved by the incredible work of the CAP board staff. They've really gone above and beyond in this moment. So I want to thank Paul and Peter and Linda for the incredible amount of work that they have put into this process. There are many items on the CAP board radar right now, and they are doing a tremendous job of juggling all of them. Their work in engaging with the public and in preparing materials for this meeting has been essential, because I mentioned in the November meeting that it's critical to understand the proposal before we vote on it as a board, which brings us to today. So today we will be hearing from the co-applicants about the updates to the proposal that they've made since presenting to us last month. You've received an updated version of the application in your materials last week. We will also be hearing from members of the public who would like to provide additional input that is specific to the variance and conditional use permit that we are considering. You should feel free to ask any and all questions that you have. I want to make sure that you have all the information you need to make an informed decision about this proposal. To that end, the CAP board staff will begin the Bethesda portion of the meeting with a presentation about the specific information we have and the criteria we should consider when making a decision. Staff will provide some background ahead of our conversation on the conditional use permits if the variance is first approved. As a reminder, today's Bethesda section is divided into two parts. First, we'll discuss the variance and vote on it. If the board decides to deny the variance, the meeting will end. If the board decides to approve the variance, we will then move to the discussion and vote on the conditional use permit. I also want to make sure that we allow as much time as needed for a board discussion on both topics. So if the variance conversation or conditional use permit conversations take longer than anticipated, I will work with staff to find time next Tuesday for continuation of this conversation at a full board meeting. I recognize that co-applicants have requested that we act quickly because we are in the middle of a global pandemic and economic downturn that has exacerbated existing housing problems. But we also have a responsibility to act after thorough conversation and consideration. So with all that being said, we will turn to the next agenda item, which is a presentation from the CAP board staff on the particular criteria and process we are considering for the variance. I'll now turn it over to Peter Musty, our zoning administrator, to share key information that addresses the overall process and the specifics we'll be dealing with on the variance application. Peter, I'm going to turn it over to you for a 10 to 15 minute presentation.
Madam Chair, before that presentation, could we just request that the presenters identify the documents so we can find them? There was quite a stack of documents to get to via email today, and it would be just so helpful, might save some time if we know we're looking at the right documents that the presenter is bringing up. So if those could be well identified as they speak, it'd be very helpful. Thank you, Madam Chair.
Senator Nelson, thank you so much for that suggestion. Staff, please go ahead and do that so that we know what we're looking at, because we certainly did receive quite a bit of information before this meeting. Thank you, Senator. And Peter, I will turn it over to you.
Thank you, Madam Chair. I'll wait for a slide here. Thank you. As you mentioned today, we have before the board two items for consideration. The agenda is structured in two steps. First is consideration of the variance. Then, if the variance is approved, consideration of conditional use permit and conditions. MHealth Fairview has entered into a lease with Ramsey County. Together, they have filed joint application to the board to approve reuse through 18 months of the former Bethesda Hospital as a shelter and respite for those experiencing homelessness. A variance to the rules is necessary when a proposed change or improvement does not comply with the rules. In this case, we are fielding a proposal to introduce a new congregate living use, more specifically, the transitional housing facility within 1,320 feet of an existing facility. The variance you are considering is tied to the time frame of the conditional use permit. The closest facility, similar facility measured from property to property is 400 feet away, which has been open for decades. There is one other facility also within the radius of exclusion further away, located to the southeast on Robert, south of University, which is also operated for decades. The requirements in the rules regarding timeline and public notice have been met. Today wraps up the formal processing of the variance, with the board meeting serving as the official public hearing. And then, as Madam Chair previously mentioned, should the board approve the variance, we would then move to consideration of the conditional use permit. There are 6 criteria the applicants must meet for granting a variance, the granting of a variance. The duty of the board today is to consider those arguments and then make judgment as to whether the criteria have been adequately satisfied. CAP board staff and Christy Eller from the Attorney General's office are both available hopefully to answer any questions you as the board may have. Of the criteria listed, it's likely that the first few may elicit more of the discussion today. The co-applicant team, Ramsey County and mHealth Fairview, are prepared to share information about the proposal on file, including what very recent changes have been made as their operations planning has evolved. And they will also summarize their arguments in regards to the variance criteria. Madam Chair, that's the end of the staff presentation at this point.
Thank you so much, Peter, for that detailed background. It's laid the groundwork for the rest of our meeting today. So we'll now turn to the co-applicants, Ramsey County and mHealth Fairview, for a presentation on the updates to the application and specifics of their variance application. Board members, let's hold on questions until the end of the presentation. We have set aside time on the agenda for questions immediately following this presentation. Peter, I will turn it back to you to transition us to the presentation. Thank you.
Thanks, Madam Chair. With that, I will turn it over to Jean Kruger, Director of Ramsey County Property Management. And I'll be asking Jean to ask each of the co-applicant team speakers to introduce themselves before we turn the slides on for their presentation. So Jean, if you'll take it away at this point and introduce your team, the folks here that are speaking.
Thank you for that, Peter. Madam Chair, I want to thank the CAP board members for the time today to allow us as co-applicants to present to you. I would ask if all of the representatives from the county and from mHealth Fairview would go on camera. And I will then ask each of you to perhaps just state your name and your position within the respective entity. We'll go through that and then we'll work our way to the agenda. So if I could start and ask for the commissioners first, we'll start with Commissioner Mattis Castillo.
Hello, Madam Chair, members of the board staff. I'm Commissioner Trista Mattis Castillo, and I am the chair of the Ramsey County Policy Action Group on Homelessness.
Thank you. Commissioner Ortega.
Good afternoon. I am Commissioner Rafael Ortega for the 5th District, which includes downtown and the Capital District area. Thank you.
Thank you. Commissioner McDonough.
Good afternoon, Jim McDonough, Ramsey County Commissioner, District 6. Glad to be here.
Thank you. Ryan O'Connor.
Hi, everybody. Good to be back with you. Ryan O'Connor, Ramsey County Manager. Thank you for your time today.
Thank you. Keith Lattimore.
Good afternoon. Keith Lattimore, the Operations Chief of Housing Stability and our hotel operations.
Amy Schmidt.
Good afternoon, everyone. I'm Amy Schmidt. I'm an assistant Ramsey County attorney.
Thank you. And we'll switch then to the Fairview representatives. Trudy.
Absolutely, Madam Chair, board members. I'm Trudy Trisla. I'm acting as Chief Administrative Officer and here for Fairview Health Services and Health East. And I'll ask Paul, I believe, to introduce himself, who's a new face and voice to you. Paul.
Good afternoon. I'm Paul Onifer. I'm the Vice President for Operations for Fairview and Health East. Thank you.
Thank you, everyone. If we could then move to the presentation, and we'll just maybe quickly show the next slide for the introduction case anybody wanted to just get another look at who is with us today. Only some of the folks you're seeing here will actually be presenting, and so we can move to the next slide for the agenda. And we're going to start out today with some words from Commissioner Modis-Castillo on shelter initiatives, kind of a brief update with what the county has been working on. I have a few words from Trudy Trisla with Fairview. Then Keith will talk a bit about the changes or updates, if you will, to the shelter plan, a few that have happened in the last month or so. Amy Schmidt will talk about the variance requirements, and then we will turn it back to the CAP staff for next steps. I would ask that each of the presenters here, as you finish your portion, that you just turn and introduce to the next, and we'll move forward. Commissioner Modis-Castillo, if you would begin.
Great, thank you, Jean. Madam Chair, members of the board, thank you for taking the time with us today to further understand the request by Ramsey County. And in some aspects, it feels like a plea because of the amount of work we have been engaged in over the last 10 months. We're here asking for your help and consideration by granting us the variance and conditional use permit to utilize the now vacant building, formerly known as Bethesda Hospital, as a shelter for our most vulnerable neighbors experiencing homelessness. In the past 10 months, we have experienced unprecedented rise in homelessness in the Twin Cities during the COVID-19 pandemic. We're now experiencing the winter weather we expected, with temperatures dropping to dangerous levels and forcing many outside to resort to lighting fires in order to stay warm. It's increasing the risk to life, limb, and property. So it goes without saying that we desperately need to move individuals inside quickly. The risk grows greater with each passing day. Ramsey County, in partnership with the City of St. Paul, numerous nonprofit service providers, advocates, and those experiencing homelessness have been working together to bring additional space online before the year's end. If all goes well, we will have brought 700 new beds online by the year's end, each designed to meet the unique needs of our unsheltered neighbors. Each piece of this complicated system is critical in order for us to have solutions for everyone currently sheltering in the cold. And Bethesda plays a pivotal role in making this all work. I'm here today because we cannot reach our goal of housing the hundreds of people unsheltered in Ramsey County without the requested use of the Bethesda building. This will provide a 24-hour, 7-day-a-week shelter for 100 men who we believe are ready and referred from community outreach teams and other shelters, and provide them with a holistic approach to mental health and chemical dependency services. Though we have not yet selected a service provider, pending approval of the conditional use and variances today, I can say we have received very good applications from long-standing providers in the community. In addition, Bethesda will provide COVID-19 respite care for up to 68 people, which is critical as we are now experiencing outbreaks in encampments. And we want to ensure that people are healthy before moving them on into other shelter system and housing solutions, something this building is uniquely set up to accommodate. Just today, we had a meeting with M Health Fairview with an update about ongoing work with Ramsey County to develop clinical services for the Bethesda shelter site. We meet together weekly with a team from M Health Fairview and the county, and initial plans include an RN triage clinic on site providing assessment and care, immunizations, wound care, and referrals to clinics pending finalized agreements and approval of use. We're asking today for your help and your partnership to address this crisis. The plan before you today reflects the hard work to address the concerns of the immediate neighbors and the greater community. To include changes of proposed services and security of the site, we have led a series of listening sessions, and commissioners and staff have had dozens of one-on-one conversations with neighborhood residents and stakeholders, and we are committed to continuing the relationship building and engagement throughout our occupancy at Bethesda and beyond. We believe that the plan we are presenting today will be one of mutual benefit in occupying and maintaining an otherwise vacant building while meeting the real-time urgent need to shelter our most vulnerable neighbors. Thank you for being part of the solution to end homelessness and to provide shelter for our neighbors, especially in this time of cold and a global pandemic.
Thank you, Commissioner. Again, I believe I'm next on the agenda. I just wanted to briefly comment again, Trudy Trisla with Fairview and Health East, and just want to reiterate our continued support for the use of this site for this purpose. We continue to believe, as we articulated at our last session, that it's an important aspect of meeting this urgent critical need that was described so well by the commissioner. It's an important time, both in terms of our external environment that was described as well as in the pandemic, and it's an important part of combating that spread. And so we want to leave enough time for questions, so I just wanted to reiterate our continued support and appreciate the board's time. I'll turn it over to Keith Latimer, I believe, who is the next on the agenda.
I'll speak a little bit about some of the changes and standards that we have in place for Bethesda and our other shelters. We've proven that these standards have been successful in other areas, and we would be also using these same standards for Bethesda. What they call for is 24/7 on-site staffing, staffing who understands CPR and Narcan training and who's well informed for working with this population. We also have wraparound services that will be included. That would include 3 meals a day, as well as transportation services, healthcare, and nursing. We also have individuals who would be there to continue to work on pathways to housing stability and to move folks and navigate them through the system, so they would be able to remove barriers that are preventing individuals from gaining housing. And last but not least, you've heard before, the 24/7 presence of security are the standards that we have in place for all of our locations. Next slide, please. I want to talk a little bit about some of the updates that we have in place. As some of you may know, we initially had plans in place for this particular location to be what we had considered a low barrier shelter. We heard strongly from the community who had some concerns about allowing those straight from encampment areas to move into the area and some of the potential problems that it could cause. As a result, we went back and did some deep thinking and was able to come up with a different plan. The model we currently use, we have identified 2 additional locations that we operate to be an entrance point into the hotel operations system. And I like to consider it as an entry into our system and then have opportunities for what we call step up and step down. So the proposed use would be that individuals will be referred to this location from our shelter partners, law enforcement, and outreach workers, and they will go into one of our other sites, which will be considered Mary Hall for young men, and we would consider Luther site for women and couples. And those individuals would remain in those areas until spots open up in a step up program. The minimum amount of time that they would have to stay there in order to be eligible for this is 7 days before they are eligible. And during the 7 days, we will be looking to see if they are going to be successful in our step up program. And then a referral could be made to our other locations as well as Bethesda So we have some understanding if they will be successful in those locations. And so when we talk about Step Up, Bethesda would be used as part of that program. And we found that this program has been highly successful in our other areas, and we would be adopting this, so it would be the same for Bethesda. As we mentioned before, the 24/7 security on campus. We've also done some work to assure that we have phone numbers in place and numbers for non-emergency contacts for this location. Next slide, please. With our community engagement, these are some of the things that we've completed. Most importantly, the virtual town hall meetings that was completed with our elected officials who were present on this call, as well as Ramsey County representatives to talk about this proposal. As you've also heard from commissioners, one-on-one and small group meetings, as well as coming to the CAAPB board zoning review community meetings as well. Next slide, please. So at this point, I'll pass it over to Amy Schmidt, who will be talking about our variance requirements.
Thanks, Keith. Thank you for the opportunity to talk about the technical aspects of what the county and Health East are requesting in terms of the variance. The county has submitted a letter to the CAAPB board members. It was submitted late yesterday, so perhaps it might not have reached all of the members yet, but it is something that we ask to be included in the record and for you to consider it as you deliberate the application.
Amy?
And I'm sorry, yeah?
Oh, no, that letter went out this morning at 3 o'clock, so.
Oh, excellent, thank you. I'm sorry to know that somebody was doing that at 3 o'clock in the morning, but thank you for sending it and confirming that. I appreciate it. So you have all the information then from the county as far as legal arguments as to how the county satisfies all 6 of the requirements for the variance. And so I'll just emphasize a few things. First of all, that the CAAPB board has broad discretion in making the decision to grant the variance. And it isn't the factors that we would really like to focus on are basically the first 3. Number 1 being the reasonableness of the proposed use by the county. Under the circumstances, the use is enumerated in the rules as a conditional use. So I think it's safe to say that the legislature would not have included the potential use in the list of what's acceptable and what's reasonable if it were an unreasonable use. But for the existence of these other 2 similar uses that fall technically into the same category, we wouldn't be here asking for a variance at all. We would be simply here asking for a conditional use permit to be granted with reasonable conditions on the proposed use. And I don't represent Health East, but I mean, I do understand that under the circumstances, they are in a transition period in making decisions about how to use the property. And so the county's proposed use is reasonable, particularly under the circumstances, because it keeps this building and property in service to the community, to the public, and it allows for the county to fulfill the needs of a very vulnerable part of our community, and Commissioner Matas Castillo described that very, very well. So I won't listen to her on that. She made a great description of it. And so when it comes to the reasonableness aspect of the decision about whether the county satisfies this criterion, reasonableness basically just means that, and I'm sure you know this, but I'll say it for the record, that in this case, the county as a user of this property is proposing to use the property in a specific way that simply is not allowed by the rules. There's not a statutory or rule-driven definition of what reasonableness means, but I think it's under the circumstances, it's clear that this is a reasonable use. It's not, I mean, it's driven by the crisis that we are in because of the pandemic, and it's not just a question of capacity for shelter space in the county system. It's also about safe social distancing for people who need to be in the system and served by the county. And the immediate use of this building is also very cost efficient to taxpayers. Pardon me? I'm sorry, I thought I heard somebody talk. I don't want to talk over someone else.
Please continue.
Okay, sorry. I just wanted to emphasize that this is efficient for taxpayers, for the county to be able to use this property, because to continue to use hotels and other facilities will continue to cost taxpayers more money than the opportunity presented with this property. And given the size and the configuration of this building and the age of it, just general characteristics of the property itself, in this environment, it's simply the most efficient use of this building to continue its use to serve the public. The other thing that I would emphasize is the second criterion related to the unique characteristics of the property and the words in the rule are the plight of the landowner, and that's where we get to the aspect of the distance requirement. Like I said, it wouldn't even come into play at all, but for the fact that there are other two uses already located in the kind of no-go zone, as you might say. And the county can't control that those uses already exist. And so, as the rule describes, it needs to be a circumstance not created by the property owner or user in this case, with the county. We can't control that. And then it's also, as a practical matter, I mean, the 1,320 feet, a quarter of a mile, I mean, that's the way that that's measured. When you get into sort of a boots on the ground sort of situation, it is when you use that distance requirement, it really does not result in a concentration of transitional housing in this area. The county is only going to use or control parts of the building and the property. All of the property is not included in the premises that the county has leased. And so if you take the measurements to the actual parts of the property that will be used, the other facility that's down on Robert Street is very likely outside of the 1,320 feet. And then the other use that's up on Capitol Heights, in a scope and scale comparison of that use of 6 condominium units versus what the proposed use on the Health East property is, it's not an apples to apples comparison. There's a natural, there's buffering and separation between these uses. There's a grade separation between the Health East property and the use down on Jackson Street and Robert Street. And then for the other property that is indeed closer, the private park or the private garden is located between the two properties. So it really does not result in a concentration of this type of use within the district. And then the third factor.
Ms. Schmidt, I'm sorry. I'm going to ask you to try to wrap it up within the next 2 minutes, please. Thank you.
Yes, ma'am, I will. I have just one more thing to say, so thank you for that. The other thing that I would say is that the third factor being about health, safety, comfort, morals, and welfare. I know there are a lot of fears about crime and danger and other things that would come into the neighborhood as a result, but there is no evidence that the short-term use that we're proposing will have these dire effects. In fact, they're in a separate court action that was brought by the Capitol Heights homeowners against the county and Health East. Just today, the judge in the case issued her order denying their request for a temporary restraining order, and the judge specifically found that any harm to the neighbors is speculative and that there would be no irreparable harm to the neighbors if this use is allowed to go forward. So that's the last of my comments, and I think that is the end of our presentation. So we would move to questions at this point. Thank you very much.
Thank you so much, Ms. Schmidt. I appreciate, and Commissioner Masticastillo, thank you for being with us and your ongoing leadership. We appreciate it. So members, we now have an opportunity to ask some questions. We're grateful for this presentation. And so do you have any questions for the co-applicants? We have about 10 minutes, but I want to make sure that the people have all their questions answered as we make a decision regarding the variance. Senator Nelson, I see your hand raised. Please go right ahead.
Thank you, Madam Chair. I'll turn my video on here. And I want to thank the presenters for the very thorough presentation. And I have a couple comments and a few questions that go with those. But what I would say is clearly the case was made, which of course we all know, there must be safe, secure shelter. It's a necessity of daily living, and particularly in Minnesota. You cannot think about living outside, and I'm wondering if a number of the homeless men and women who are looking, or who the county, Ramsey, is hoping to relocate to Bethesda, were these men and women who were part of the outdoor shelters all summer that were broken up? Is that the problem we're trying to solve here?
Madam Chair, Senator Nelson, Ryan O'Connor, County Manager, the short answer would be yes to that. But it's a multiple group of solutions coming together at multiple sites to solve the encampments, but the overall numbers driving the issues are in fact including those encampments that we just referenced.
Thank you. Madam Chair, could I ask the rest of my questions now?
Yes, go right ahead, Senator Nelson.
Thank you, Madam Chair. So there's this great need. I definitely understand that. A brief question for the staff. Does the CAP board staff, I think I've been on the CAP board now for over a decade, and usually there's a recommendation, and I just don't know, did the CAP board, did the staff make a recommendation to approve this variance? I'm just really focused on the variance.
Madam Chair, Paul Mandel.
Yes, Mandel, go right ahead.
We are not making a recommendation. We have simply passed everything on this. We do have recommendations with regards to the CUP, but on the variance, we had the county's submittal and the opponent's submittal, and we left it at that.
Thank you. Thank you.
Senator Nelson, go right ahead.
Yes, thank you, Madam Chair. I so appreciate. So then my other question had to do, and so it's unusual, first of all, not to have staff approval or disapproval. They do both on these projects. But then the other question had to do more about the temporary nature. And these questions are important to me because this is what's going to help me determine my vote regarding the variance. And so the temporary nature of the proposal, I understand it's for 18 months, but I'm wondering if one of the commissioners could tell me, what do they think is going to happen in 18 months? Are people suddenly not going to be homeless? I mean, it is a challenging time. There's just no doubt about that. And so what's the plan after 18 months?
Commissioner Masticastillo, would you like to take a crack at that?
Yes, thank you. Thank you, Madam Chair, and thank you, Senator Nelson. You make a really valid point. Our goal is that we are working really hard to go upstream and meet the needs of housing. So we have signed the lease up into which we have funds available based on our budget. And at the same time, we're working really hard to invest in affordable housing in Ramsey County and additional partnerships. Just yesterday on our board, we moved funds in order to fund 306 new units of affordable housing in the next year. And so we're working really hard and creatively to go upstream to make sure that we can provide solutions for the folks who might be residing at Bethesda or in any of our other shelter systems. But it is definitely an ongoing work in progress as we continue to move forward.
Thank you, Madam Chair. I am concerned that I understand the issues regarding affordable housing, but we're talking about a significant number of Ramsey County residents right now who are without housing. And I guess my concern is the temporary nature of to think that suddenly there's going to be a place for them in 18 months. And then with all due respect, this really was something that's been percolating since the summer. And I'm reminded a little bit about, my dad was a high school principal, and he had a saying in his office. It said something like, your lack of planning does not my emergency make. Well, what I would say is this is very serious because we're talking about people's lives here in a harsh Minnesota winter. But I guess I just am a little bit befuddled that this is not new. It didn't just spring up last week. It didn't even spring up in March, quite frankly, with the COVID, although COVID certainly probably amped up the need for housing for homelessness. I definitely understand that. But I'm just a little befuddled that here we are on December 16th, and we get the Ramsey County Council on why the variance is permissible, or they're arguing for that, and it was mailed out at 3 o'clock this morning. And so I have asked Senate Council to take a look at this. I understand Ramsey County's point of view, but I also think there are hundreds of residents who live in this capital area, and there are hundreds of Capitol employees who walk, park, and work in this area. And I do believe it's incumbent upon us to have also an outside look at this issue regarding the variance. And I do understand, and to that point of those hundreds of people who live there and work there, I believe there's been a great study in the security at the site. I think I might have heard that at one of our first meetings, but has anybody studied or analyzed security at the surrounding areas? I'm sure the neighbors have talked about that, but I'm thinking about the Capitol now. I mean, there was just a security hearing yesterday about unrest in the Capitol area and why the fence that costs, maybe $8,000 a month needs to stay up around the Capitol. And so I'm just wondering, what about the security of the Capitol employees? And is the Capitol security going to be reimbursed for additional calls? We know that that is likely to happen. And so if somebody could kind of address that security issue and also that would be incredibly helpful.
Thank you, Senator Nelson. And I think Mr. O'Connor, I see you leaning forward, or are you the individual who'd like to answer that question? I also would just acknowledge that the Bethesda site is outside of the jurisdiction of the state troopers. This would be St. Paul Police, is my understanding, who would be responsible.
Madam Chair, though, my question is not at the Bethesda site, but at the ancillary sites around that, where the Capitol security area, where the Bethesda residents may well end up, whether it be in the buildings, the parking ramps, or other things. So my question is particularly not on the Bethesda site. I think that's been answered, but I'm talking about the Capitol area around the Bethesda site.
Great, thank you. Mr. O'Connor, go right ahead.
Oh, I can't hear you.
I'm sorry, can you hear me now?
Mm-hmm.
Okay. Madam Chair, Senator Nelson, I'll do my best to quickly answer multiple threads there. On the security piece, we have worked with Commander Ellison of the St. Paul PD and looked at similar statistics regarding sites such as Listening House, one of the day shelter sites, and have not seen a demonstrable increase in type 1 park crimes since the opening of that site. We have that information and have been doing looks through St. Paul, nor have we seen significant changes in crime in other neighborhoods where we have been making movements both before and during COVID. And so we will continue to work with St. Paul PD, with on-site Capitol security, but we ultimately in our looks would not agree with the idea that crime necessarily increases due to a proximity to homelessness or individuals seeking a place to sleep. On the other part about timing, I would just note that I understand the urgency and I appreciate the Capitol Board working with us under urgent timelines. We have been trying to do much of this work regionally and with multiple partners over multiple years. Clearly, it has come to a head this year, even as we have been seeking to expand sites in Ramsey County. And the reality of this particular site is it was September 14th when the opportunity came our way. And so you are right that it is late in the year. And I do appreciate, again, you considering it today, but we didn't have this site on the available list of opportunities earlier this year.
So,
and just a reminder to board members that any questions that we have now should be specific to the county after their presentation. We have community members as well who'd like to speak to the variance. Senator Nelson, do you have additional questions for the county or for Health Fairview?
Yeah, just one, and that would, thank you, Madam Chair. And that would be, so what was the plan before September 14th? Because even September 14th is a little late to say suddenly we need some housing for 100 Minnesotans who don't have housing. So what was the plan prior to September 14th for the county?
Madam Chair, Senator Nelson, we expanded by approximately 350 beds without Bethesda being a part of it, but we need 500. We had been 18 meetings in with the state of Minnesota and regional partners. We did not have an answer for this final gap. We were working diligently to try and address it.
Then my last question, what's type 1 crimes are certain type of crimes, very high level crimes. What are the statistics for type 2 crimes around the comparable areas? We're talking about type 2 crimes now, which are less severe, but none of us would want to face those.
Madam Chair, Senator Nelson, I don't have that information.
But you have to speak right into your mic, sir. I think you have a directional mic. Can't hear you here.
And Senator Nelson, it would help if you would put your mic on mute and others while we're for the reverb. Thank you.
I apologize if my mic was giving trouble. Madam Chair, Senator Nelson, I do not have that information in front of me. I would pledge that we would work to follow up on that, but I can't give you an accurate number right now at this time.
Thank you. And if you could also include what is a type 1 crime and a type 2 crime, I think that's an important piece for people to know. Thank you so much. Thanks for your patience, Madam Chair.
Thank you, Senator Nelson. Representative Dean, go right ahead.
Thank you, Madam Chair. And I have a couple of questions, not a lot. I guess my first one would be to Mr. Latimer. If you could speak to what do you think the typical stay time would be for an individual in this shelter? You spoke about the step up and the step down programs, and I'm just curious, is it going to be 3 days, 5 days, 7 days, 24 days? I mean, if you sort of have a sense of what that's going to look like.
There is no specific days. One of the things that we do is once they're in there, it could be a matter of time that they may have been already working with navigators to, pursue housing. So it could be a day, it could be 2 days, but it could be as long as we're in there. For some, are just on different perspectives on that line. Some might be just starting the process of trying to get and find, resources, where others might be already working with individuals. Folks coming to this location will also be able to go to other locations as well. That could be step up. We have several. So they wouldn't necessarily come only to Bethesda. They could be coming to our elderly hotel, our women and couples hotel, or even our younger men hotel as well.
Great. Thank you. And my next question, I'm not so sure it's a question. It might be a question for Mr. Musty. When I look at the map that shows the distances, geography is a huge impact on the site. And I know that because I've actually run from the state office building in these neighborhoods on a, fairly decent afternoon. And, the measurement is going directly to the property lines, not to the actual, building in use. And I know that those distances would change significantly. But also in that context, when I look at the plan of the campus and the plan of the actual existing hospital building, there's sort of there's the front entrance, which is across from the garden, and then there's another entrance which appears to be on the I guess it would be the west side. If folks could speak to that a little bit on what is typical going to be the entry and exit on this building. That might be the folks at the county. And then one last question, and then I'll get off. I'm curious, how many beds were in the existing Bethesda hospital building? You know, we've heard the 168 with 100 being the short-term homeless facility, and 68 being for those impacted by COVID. So I guess I asked a couple questions, and if folks could just sort of try to address those issues, I would greatly appreciate it.
Great, thank you, Representative Dean. Who from the county? Is it Mr. O'Connor?
Madam Chair, I don't know if you can hear me quite yet. You can hear me? Okay, sorry, yeah. This is not going well for me right now. I'm gonna ask Gene Kruger to answer this one because I was playing around with my microphone a little and I need to plead ignorance for just a second. Thank you.
Great. We can hear you. You sound great though, so there you go. Ms. Kruger.
Yes. Thank you, Madam Chair, and Mr. Dean for the questions. I'll answer a couple of them to start with. You're correct. The actual hospital building, if you will, on the diagram that's being shown right now is really under the word Bethesda and North. That is the facility and where the residents will be housed. If you look at the word Bethesda, about under the H and the E, is what has been the main entry to the hospital, and that will be the main entry used for the shelter portion of the operations. If you look then south of the building a bit, you can perhaps make out where the ambulance driveway and ambulatory bay is. That's the entry that we will be using for the respite operations in the facility. So on the property in total, our activities in and out of the building will all be in this, generally speaking, northwest portion of the property of the parcel. I think that might answer the entry questions for you. I will just add, you're right as well, Mr. Dean, from a distance perspective, the referenced second transitional housing facility, if you add in the distance to the building from the edge of the property, as well as potentially an elevation change, I would definitely state that your actual distance by foot is over the 1320. But again, as the crow flies, the edge of the property is over that, is within that 1320. As far as your question on hospital beds, if I could, I would like to turn that over to Trudy with Fairview.
Thank you. And Trudy, before you start, I just want a reminder that we have to still hear from the community. So we want to just keep things moving. Trudy, Ms. Trisla, please go right ahead. And you are on mute.
That does not help. Thank you, Madam Chair. If I understand the question, the number of beds utilized at the Bethesda site at its maximum was around 60 to 80. It average census was about 30 if you look at a year-to-year average, and its use as a long-term care acute care hospital.
Thank you.
Okay. Yeah, thank you. And just this might be to Ryan or to Commissioner Maticastillo. So we can assume that the front entry, if we're calling it that, on the eastern portion of the main building, will probably have lots of eyes in that area for the individuals, residents that will be coming out. If I'm gonna guess, that's probably gonna be one of the safest parts of this particular project.
Madam Chair, Representative Dean, that's correct.
Thank you. Thank you, Madam Chair.
Thank you, Representative Dean. I'm going to go to Ms. Belton next, and then Representative Hertaus. Ms. Belton, go right ahead with your question.
Great. Thank you, Madam Chair. At first, I just want to say thank you to all of the people who have worked on this. This is really tremendous. And so thank you for providing clarity to the board. It seems like you have done some massaging of your application since we last met with you. And so I appreciate that as well. I just have a couple questions in regards to clarifying who is your intended guest for the shelter, just in terms of age demographic and gender demographic. I thought I heard 100 men, but maybe it was 100 Minnesotans. So if you could clarify that piece. And then the second question is, you talked about this being more of a step-up shelter, and so and that there was a 7-day waiting period before you would be moved into this step-up facility. Do you have people ready in your other places to move into this building immediately, or is there going to be some like lag? So those are my questions. Thank you.
Thank you, Ms. Belton. Go right ahead.
Thank you, Madam Chair, Ms. Belton, and Keith, finish if you want. I'll go quick. I'm just trying to do our best to answer fast. We do have people today, to answer your second question, that would be ready to move in, who have been in our shelter program for a while. I do believe it's all men. We are opening other sites right now on the Luther Seminary campus, and we are in conversations with the Sisters of St. Joe's over near St. Kate's, which are housing different populations that would involve women and families. So there are other properties coming online in similar ways. Keith, what did I miss?
The only thing is that we do have a respite part that women would be able to come to, and those are women that is in the system who have tested positive for COVID. There is a section that would include women. Outside of that, it would be a men's facility because we have places for women to go.
Okay. Thank you so much. I appreciate that.
Thank you, Ms. Belton. Representative Hertaus, go right ahead.
Well, thank you, Madam Chair. And are you able to hear me okay?
Yep, you sound great.
Good, thank you. Well, Madam Chair and members, we've been inundated with a lot of information about this particular application, and certainly a lot of comments by local people. I want to kind of make some comments from my own professional background, both as a caring and compassionate person for those who are in need, as a past healthcare provider and a coronary care nurse, intensive care unit nurse in my younger years. I started out in that direction, but I also spent more than the last 30 years as a real estate developer and more than 35 years as a real estate broker, and also a building contractor. So I'm familiar with the variance process and conditional use process. And as a matter of law, when conditional use permits are approved, they run and bind with the land in perpetuity as long as they are continue to be used. Now, I know that this application and the variance application is for 18 months. I have some concerns that this is kind of a foot in the door, if you will, because if there would be a move to extend the use of this facility, the conditions of the conditional use permit, or the fact that a conditional use permit has already been approved, is one less barrier or fence to go over 18 months from now. Now, I would like to comment a little bit with regard to some of the overview and the comments that have been made about the reasonableness. And we have 6 criteria that have to be met in order to grant a variance. And on the surface, it appears as though there are those who are willing to push a square peg into a round hole, so to say, because the urgency demands that we forget about the rules or the process. But I can tell you that in real estate, people make buying decisions largely on their reliance of the existing zoning laws. And that doesn't mean that they should just simply be discarded at the behest of those who are around them. Zoning laws are created to have criteria to create stable neighborhoods and stable communities. It's intended to inure to the benefit of all of those adjacent property owners as well, and their individual property, private property rights. So, you know, highest and best use is a principle that guides the use of real estate. And I think there may be further in this meeting, I'll circle back with regard to maybe conditions that would fit under the current use as it addresses the homelessness issue. But, you know, this really is turning into a boarding house in which no zoning is permitted in this area for a boarding house. Factually, there's not boarding houses at all anywhere in Ramsey or Hennepin County, or probably across the state for that matter. Now, a little more than a year ago, in committee, I think it was May of 19, an issue came before the legislature on a committee that I served, and I made some comments about something which invoked a few phone calls from Hennepin County commissioners regarding homelessness. And we had a very productive and good conversation about it. In preparation for this meeting, I did reach out to Hennepin County officials and I asked what they were doing with regard to some of their issues. And most recently, and I know Hennepin County was one of those LGUs large enough in population that they got COVID money directly from the federal government without having to have the rest of the money distributed by the state. But they have recently spent $23 to $25 million of COVID money, a good use of the money, one-time acquisition to actually acquire properties, to own the properties for homelessness. $13 million for one facility, $8 million for another, and most recently a few more purchases in that arena. What I also am familiar with is the demographics of the homelessness. And in conversations that I had just this morning, Hennepin County, they won't say it publicly, but I'll share what they told me publicly, is that part of the program dollars that they're using, there's been quite an influx of homeless people coming to the area from outside of the state. They know this by interviewing the people and where they're coming from. And so in our zeal and desire to solve a problem, we are also creating more of it by the manner in which we're approaching this issue. And it's not an easy circumstance to deal with. And we all should have care and compassion for those who are less fortunate. But we know that largely of the homeless population, it is comprised, and I don't expect the demographic in Ramsey County to be too much different than it is in Hennepin, but it's largely comprised of single parents who are homeless and don't have good job skills. It is also a significant part of the population is those who have mental health issues and drug addiction issues. And what I hadn't picked up on in any of the materials provided to us earlier, but was revealed in the opening overview, is it appears to me, at least on its surface, that 100 men are part of that demographic that probably the neighborhood should be most concerned about. And so I think I will kind of end it there with some comments with regard to the marketplace, but this marketplace is really with regard to the real estate and the real estate values around the proposed use. The marketplace is really this inanimate object, which is really comprised of individuals, buyers' emotions and motivations in terms of making home buying decisions. And there are certainly going to be, and I can tell you from my own experience in owning real estate and marketing real estate with regard to what happens in some of the other metropolitan suburban communities as it relates to the perception, not always just the actual facts of crime, but the perception of it greatly influences buyers. And those people, for anyone to say it doesn't affect real estate or real estate values are simply wrong. Part of the intangible effects of owning property around something when the rules are being changed through no fault of the buyers that made a decision to purchase a home in the area or to reside in the area. Some of the value impacts are prolonged market times. Some of it is seller concessions with regard to financing and being able to move or get rid of their property. And oftentimes it requires them to make substantial additional investments into the property to make it competitive in lieu of the encumbrance that has now been put upon them to compete with other properties elsewhere within the community at large. So There are some real legitimate concerns by those who are opposed to this variance, and it's very clear that all of the conditions simply are not being met by the applicants, and I don't think it's okay to just simply throw the other provisions in the variance requirements to the wind because of an urgency. So I'll end it there, and I think we'll probably circle back on some other ideas, because I do have some ideas in which I think this facility could conform to its current use and still serve the homeless. Thank you, Madam Chair.
Thank you, Representative Hertas. This has been an important conversation, and the questions that have been asked have been good ones. So thank you. I want to make sure that we have an opportunity for the public to comment on the specific topic before us, which is the variance itself. You received in your packets a number of letters from community members and community groups, and we won't ask those people to read those out loud here, but our neighborhood group did ask to testify in live time here before us, and I will turn it over to them now. Again, please do keep your comments to the variance issue. If the variance is approved by the board, there will be time for input on the conditional use permit. So with that, Peter, Mr. Musty, I will turn it over to you to facilitate this section. Thank you.
Thank you, Madam Chair. We now have a member of the community that has stepped forward to speak today, specifically in regards to the variance. Michael Meneghy is with us today, representing concerned citizens of Capitol Heights. And board members, you should have all received in your packet attachment K1, and he may be referring to that letter from, again, concerned citizens of Capitol Heights. Michael, are you?
I'm here, Peter. Thank you.
Thank you.
Wish to start by thanking the CAP board for their hard work and attention to this matter, their ongoing community engagement, and the opportunity to speak today. I actually will be referring to the revised variance application that Ramsey County sent late yesterday afternoon, and Mr. Mandel sent out at 3 a.m. this morning. That's going above and beyond, Paul. Want to point out the instances where the county statements on this variance application are at odds with the truth. First, regarding the question of reasonable use. County states that all of the uses suggested by our committee, the CCCH, are speculative at best and indeed are the opposite of reasonable. The Bethesda campus was an operating hospital just 2 months ago. Clearly, the property could still be put to that reasonable use. The October 5th announcement that Bethesda was closing also cited the intention of Health East to rent it to Ramsey County for the shelter. We have no indication of Health East even attempting to find a reasonable use for the Bethesda campus or having discussions with any prospective tenants or buyers except Ramsey County. Second criteria, the plight of the landowner is due to circumstances unique to the property, and the circumstances were not created by the landowner. The variance application sent yesterday reads, despite the assertions of the CCCH, the plight of the county here is not the discontinuation of hospital services at the property. The plight is the proximity of 2 other traditional housing uses within 1,320 radial feet of the property. I don't know where to begin. Health East is the landowner, not Ramsey County. This statement makes no sense. The variance application goes on to read, although the proposal use is within 1,320 feet of 2 other traditional housing facilities, there are practical considerations as well, namely that 1,320 feet is measured as the crow flies from the closest edge of the entire Health East property, of which the county is leasing and will be in control of only a portion. It's well established under the CAP board rules that it is 1,320 radial feet from the edge of the property. Radial means straight, or as the crow flies, as the county put it. The Google walking maps they attached to their letter show that the actual properties are more than 1,320 feet as you walk. Well, it's not radial feet. That's walking around the neighborhood, and that is not an accurate depiction of the distance. And I'm sorry, I am just blown away by this. This does not address this requirement. So the county has not met this second factor. The plight of the landowner is a circumstance created by Health East when they decided to close a COVID hospital in the midst of a pandemic and put 900 frontline healthcare staff out of work. Moving on to the third factor, the proposed variance is keeping with the spirit and intent of this chapter and is consistent with the health, safety, comfort, morals, and welfare of the inhabitants of the capital area and the city of St. Paul. The county says the CCCH asserts an unproven and unsubstantiated parade of horribles related to crime and decreased property values. The CCCH's assertions are also based on incorrect information. They go on to say that this is no longer a low barrier shelter, but a step-up facility. The definition of low barrier is housing where a minimum number of expectations are placed on the people who wish to live there. That means that tenants are not expected to abstain from using alcohol or other drugs so long as they do not engage in these activities in the shelter. Mr. Lattimore has told the CAAPB board drug use will not be allowed in the Bethesda facility. However, the county's FAQ site on Bethesda states those who are experiencing chemical dependency or mental health issues could receive on-site services at this location as well. Despite the 7-day residency requirement, this is still, by definition, a low barrier shelter. And finally, the fourth factor, the proposed variance does not impair an inadequate supply of light and air to adjacent property, nor does it alter the essential character of the surrounding area or unreasonably diminish established property values within the surrounding area. Obviously, there are no proposed changes to the building, so the supply of light and air is not affected. I'd like to thank Representative Hertas for his comments on property values as regarding real estate within the distance of shelters. We did quote to the CAAPB board and the county a study done in New York City showing that housing within 1,000 feet of two shelters usually experience a drop of 17.4% in their value. The county goes on to say that this is not an apples to apples scenario, and that because they are doing programs and services for the population of the shelter, that it is more similar to long-term sustainable housing, which is shown to have no effect on property values over a 30-year time frame. In other words, the county is asking you to take their word that a 168-bed low-barrier shelter will have the same effect as stable, sustainable, affordable, long-term housing on the capital area. While an ideal outcome, there is no factual support for this statement. This revised application is the latest example of our committee's dealings with Ramsey County. The facts keep changing and the goalposts keep moving. On the October 8th town hall call, Commissioner Matas Castillo stated that Bethesda had to be converted to a homeless shelter because it was the only suitable facility the county had been able to find after a search lasting several months. But in the past 10 weeks, the county has opened or identified facilities at Harriet Island Pavilion, Duluth Case Recreation Center, Stubb Hall at Luther Seminary, and the Provincial House in Highland Park. I'll refer again to criteria C. The proposed variance is in keeping with the spirit and intent of this chapter and is consistent with the health, safety, comfort, morals, and welfare of the inhabitants of the capital area and the city of St. Paul. This directs the CAAPB board to focus not on the homeless population, however in need of shelter they may be, or the needs of Ramsey County, but the health and welfare of the inhabitants of the capital area and the city of St. Paul. The county makes the argument that time is of the essence and the numbers of unsheltered individuals requires extraordinary measures. But by rule, the CAAPB board can grant a variance only if Ramsey County meets all of the applicable criteria. We've demonstrated that this application fails to meet 4 of the 6 criteria. Thus, the variance should be denied. Thank you.
Thank you so much, Mr. Medegui, for sharing your opinion and your perspective. You've raised some important points for the board to consider. Board members, I'd now like to open it up for a general discussion of any questions you might have after hearing from CAAPB board staff, the co-applicants, and our neighborhood group. But I'd like to, again, remind people to focus on the variance and the subject at hand. After discussion, we will ask for a motion that we can vote on. But I'd also like to just emphasize that For folks who have already shared, to please not repeat the items that you have already discussed and shared with us. So with that, Senator Nelson, I see your hand is raised. Please go right ahead.
Oh, thank you, Madam Chair. My comments are about exactly what our previous testifier just mentioned, and it has to do with the variance and the 6 things that must be met for this variance. And he explained them extremely well. I would just almost add that I realize there's this issue about the number of feet from other type similar of homeless areas or living arrangements. I guess that's a bit of an oxymoron now that I said that, but the feet is not concerning to me, whether it's 1,320 feet, whether it's radial or walking. That's really not the issue in my mind. The issue that I see here is that point A, the property in question cannot be put to a reasonable use under the strict application of the rules. Well, of course, there's many uses. This is why I'd like to have Capitol Senate Council review the document that Ramsey sent, at 3 o'clock this morning. So I think it does not meet the requirements in Section A, and also. Well, the plight of the landowner, I don't know, maybe I understand it was, in Fairview's Health's choice to vacate the building, and perhaps, there are reasons for that. And so I'm not going to count that against that. But also, I think point C, and I would remind, and I hope you all have this in front of you, it's in the variance, but I'll just read it because I think it's so important. Point C of subdivision 3 is that the proposed variance is in keeping with the spirit and intent of the zoning and design rules for the Minnesota State Capital Area 2009 and is consistent with the health, safety, comfort, morals, and welfare of the inhabitants of the capital area in the city of St. Paul. And I would just like to make sure that we all are remembering our purpose in law is to preserve and enhance the dignity, the beauty, and the architectural integrity of the Capitol, the buildings adjacent to it, the Capitol grounds, and the Capitol area. So I do not believe that this use does that. This variance use does that. And that's not to say that it's not important. I think Ramsey County has a lot of resources, a lot of options. I just don't believe that Bethesda is the place, and I do not believe it meets the requirements for a variance. And I won't speak to point D, but I will speak to point E. The variance request, if granted, does not permit any use that is not permitted under the rules for the property in the district where the affected land is located, nor does it alter or change the zoning district classification of the property, which we did just talk about that. And the last one, point F, the request for the variance is not based solely on the desire to increase the value of income potential of the land parcel. Well, it is about the income potential of the land parcel. M. Fairview has this facility that they needed to close, perhaps because of market conditions or their portfolios. I'm not sure. They had to make that decision. It was a decision that they made to close in September. However, this point F points right to the point. That is why this proposal is before us, is because it is to increase the value to the property owner. So I do not believe that while it's an important need, I do not believe the requirements are met for us to issue a variance. And I realize we're in a pandemic, but it is very clear that the requirements are not met for issuing this variance. Thank you.
Thank you, Senator Nelson. Representative Dean.
Thank you, Madam Chair, and it's going to be an interesting conversation that we're going to have moving forward because, I'm just going to say two lawyers can present the truth in two very, very different ways. I mean, that's just the nature of their training. It's the nature of our law. It's the nature of our courts and all those types of things. As someone who, for a good portion of my career prior to being in elected office, I practiced architecture. And you spend a lot of time applying for variances for projects. And, oftentimes the ultimate piece of the variance is this something that's unique to this site? And I think that this is a very unique site. And because of that, we have all these factors. And, Senator Nelson brought up that she doesn't care about the 1,320 feet. Well, that's the only reason that we're talking about this, is because of the 1,320 feet separation for that particular type of use. I think the county is leasing the beds. I don't think the county is leasing the entirety of the property. So when we calculate those distances, to calculate them radially as the crow flies, I think is really, at best, it's sort of stretching what the intent of the requirement is. That becomes critical as someone who would design a classroom to be measured at 980 square feet versus 1,000 square feet to minimize the amount of doors necessary for a particular classroom. Clearly when you're getting close and bumping up to that 1,000 feet, the question you have to ask yourself, should that room still be required to have 2 doors? So how we parse and pick the things that we want to present to make our arguments concerning this particular project and the approval of this variance, I think that's going to be how most of us interpret what it is we're reading and what was the underlying intention of that. The neighborhood has made an argument on why they don't believe it should be granted. The county has made an argument about why it should be granted. And we as CAP board members are put in place to determine what's best for the capital architecture and area. And I personally don't believe that this will have a negative impact on the capital area. Ramsey County is a pretty significant organization. I believe that they can do many things to mitigate the concerns of the neighborhood. And so I am likely to actually be in support of granting this variance. And when we look at the conditions of all the way through F, so the 6 conditions, I think they've been met. I mean, the increase of value or income potential of the land parcel, I don't think it's based, this variance request is based solely on that. There's a key word in that sentence, and it says solely. So you can't say, well, they are going to have some income potential. Well, the key word in that is solely. And as far as the plight of the landowner due to the circumstances, I think the county's done a great job of laying it out. And I think it's, this will be reasonable use under the application of the rules. So I'm likely to support this. I know that my colleague in the House is likely to speak against it. As practicing architecture, working with developers and land folks, oftentimes their interest is the point of view that they start from and not the other areas. So I want to thank everybody for the time. Clearly there's a need for this. The need should not be the only thing that determines our acceptance of this variance, but it is a influence in that. But as mentioned earlier, the only reason this variance needs to be considered is because the distance of how this project has been measured from the 2 existing facilities. So thank you, Madam Chair.
Thank you, Representative Dean. Mr. McLean, please go right ahead.
Hi, just want to start by saying a lot of very compelling and complicated information, and just thanks to all the people who kind of prepared to give this information to us and take time to participate in this meeting. I'm a downtown resident, not quite in the Capitol Heights neighborhood, but less than a mile away. I live downtown, 10th and Jackson Street, so fairly close to the Capitol area. One thing I want to note, I just got an email this morning from the Capitol River Council Executive Director. They had a board meeting last night. I'm not on the Capitol River Council board, although I formerly was. I didn't participate in this meeting, but they just had a board meeting last night to discuss this issue, and perhaps Paul can help me out. The site itself is not within the Capitol River Council, but the Capitol is, so I think the boundary is fairly close. But I just wanted to let folks know, because they probably didn't have time to get it into the materials for everyone to review, but the Capitol River Council, which is the district council that represents downtown and the Capitol area, is in support of the variance. So I just wanted to let folks know that. And like I said, I wasn't part of their deliberations, but just got an email from them this morning. Let's see. In addition to being kind of a downtown resident, I also work downtown. I work for Health Partners on policy issues, so spend a lot of time actually in the Capitol area, a lot of time at Regions Hospital in particular, fairly close. And actually Regions has office space at 525 Park, so just across from Bethesda Hospital. Normally during the legislative session, I'm usually there daily, so not only live but work in the area quite a bit. And I will just say, and I'm not on this group or on this board representing Health Partners, but the work that I do kind of informs how I'm thinking about it. And I can say from Regions Hospital perspective, we definitely see the need for increased shelter services. Even before the pandemic, we regularly had, a number, sometimes as many as 20 beds with individuals experiencing homelessness, no longer needed a hospital level of care, but really had nowhere else to go, and would likely end up back in the hospital if they were discharged to the street. So it is something that we, I know in my professional work, keep a close eye on, and certainly see the need for additional services for the homeless population. Particularly now during the pandemic, every bed we have is a precious resource, and we need them open for those who are most in need of care. So from that perspective, any additional resources where people can be appropriately housed and not stuck in a hospital when they don't need to be is a huge benefit. I also I get to serve on a number of boards. I formerly worked for the St. Paul Area Chamber of Commerce. Still, I'm on a number of committees there, and serve on the Business Review Council for the city of St. Paul. Again, I'm not here to speak for anyone else, but just sharing kind of what I hear in those forums. Quite a bit of concern from downtown business owners about the impact of increased homelessness presence downtown, and kind of frequent pleas to that group that I sit on to just do something to provide somewhere for people to be, because it is having an impact on businesses. We hear a lot from people who own properties, apartments downtown. They're hearing a lot of people not renewing leases. So just wanted to kind of share what I'm hearing there. And I just want to kind of end my comments with a question. I don't know if we have time to hear more from the Ramsey County folks, but my question would be just what happens when you are truly out of space to shelter people, in the winter and it's cold, and I know you probably kind of stretch resources and do as much as you can. But I should also note I am on the board of Catholic Charities, so also get probably a more in-depth view of the homelessness and housing affordability crisis than the average individual. But once there is really no space, I guess my question would be, what do you do when you have someone, it's 5 degrees out and there's no more shelter space, and then I'll stop. But I just would say from my perspective, I certainly understand the concerns that have been raised, but for me, I do feel safer. I would feel safer knowing there are resources available for the people I see struggling on a daily basis. So thank you.
Thank you so much, Mr. McLean. I appreciate you. Mr. O'Connor, could you speak to that briefly? Thank you.
Yeah, thank you. Madam Chair, Mr. McLean, the short answer would be we do everything we can to have enough space. If we do not have enough space, then people are left to fend for themselves. And I don't mean that to be callous. I mean it to be realistic. In past years, we have worked to allow additional capacity within existing spaces on our coldest nights. But with COVID, we do not have that as an option this year, which is part of the struggle in front of us. And so Bethesda is one of the multiple sites that have been cited here today that are part of solving the entire issue together alongside Luther and building on St. Kate's. But the bottom line is, if we do not find enough sites, and all of these sites are a part of that puzzle, we will have people being forced to sleep outside all winter or go somewhere else.
Thank you for that. I appreciate that. Representative Hertas, please go right ahead.
Thank you, Madam Chair. And, I think it's very clear that of the 6 criteria that the first 3 all fail. The property in question cannot be put to reasonable use under the strict application of the rules. That's simply a failure on the part of the application. Bethesda Hospital was a hospital a long time ago, but it had been converted decades ago to a facility which really was taking care of the long-term disabled and rehabilitation. I even had, I mentioned to somebody who called me this morning, I had one of my general contractors that worked for me suffered a severe motorcycle crash in Wisconsin and eventually ended up at Bethesda for several months in treatment with regards to traumatic brain injury and physical problems with his neuromuscular system. So the facility was decided to be closed by Fairview, and I do believe that it can continue to operate as a facility that cares for the homeless. Particularly, there's a demographic of the homeless that are senior in age, they're disabled, and they need rehabilitation. And that is a particular niche that I feel would fit within the strict adherence to the rules of our conditional use process and the variance requirements. Item B, the plight of the landowner is due to circumstances unique to the property and circumstances were not created by the landowner. They're asking for a variance to use the facility no longer as a healthcare facility, but as a shelter for the homeless. It's not, I mean, you can make a nexus with regard to individuals who are homeless and what their reasons or causes are. But again, this is a treatment facility, not a shelter. So I feel that it fails under B. And then with regard to item C, I've already touched on, but it's a total disregard to the adjacent land uses to grant this variance based on the circumstances which have been created by a voluntary closure of the facility. So, if government had closed it or condemned it or had another proposal for it, it would still go through the ordinary processes to make sure it all conforms. But Yeah, I've had plenty of conditional use permit applications, and the radial measurement, the radial distance has been the rule long established in these types of processes, and to create some uniformity. Every property, even if it's just a corner that gets touched by this strict adherence to the rules, is notified of an impending change, and they have a right to participate and have a voice in what's going on. So I don't think that that should be minimized, because you're really changing and setting a precedent for all future applications, not only within the jurisdiction of the CAP board, but statewide. So it's very clear to me that the first three criteria, A, B, and C, simply fail with regard to this application. But I think, as I mentioned, it could serve the homeless population for long-term rehabilitation of disabled and elderly homeless people. And that might mean taking in residents from other counties to make this facility run efficiently. And that's a part of a broader discussion in terms of the homeless issue statewide, and it's more of a regional issue than it is just unique, and it maybe requires some future legislative consideration with regard to how we deal with this issue as a region, rather than just throwing the solutions onto each county to reinvent the wheel 7 times in the metro area. So I'll let it go at that, but I cannot support this application under the failure of conditions A, B, and C.
Thank you, Representative Hertas. I'm just going to remind folks that we are a little over time here with how we want to move through things. So just remind members to please be as succinct and brief as possible. Mr. Lentz, I'm now going to go to you. I'm also going to prioritize people who have not spoken yet. So Mr. Lentz, please go right ahead.
Thank you, Madam Chair. I appreciate this. These comments. I have reviewed the 6 criteria, and about when we first got that, I reviewed it in I felt in some detail, and I found myself very strongly in favor of and recommending that the variance be issued. And let me take part of my reasoning behind that is that I, about a year ago, began asking informally questions about what's going to happen to that immense portion of the Capital District, the Bethesda site, when they close the building. It seemed clear to me that Fairview would be operating that building at a substantial loss, and knowing the shifts in healthcare reimbursement, healthcare planning, and the rest of that, it was for me not a question of would it be closed, but when and what would be happening. And I asked informally people and got a lot of disinterest. I did not speak. I don't believe I brought that issue up with Peter Musty and the other staff, but I had talked to people I thought would be interested. Then last February, during our CAP board meeting, it was the very beginning twinges, if you will, of discussions on COVID. And at the board meeting, the CAP board meeting, I brought up the question of, would in fact Bethesda not be an ideal setting for a COVID hospital, and was greeted either with gasps or strong shakes of the head. No, why would you ever do such a thing? Again, I found myself worried for the capital area district, and expected what would without even thinking about the COVID direction, it had been my assumption that at some point overnight, the building would be closed. The community would have no time to think about what they'd like to see, how they would like to prepare in their community, but instead that would face them. And when I heard the proposal for this potential 18-month use, it seemed to me to be a great interim use. I did recognize right away and heard the comments, and I think a big driving issue is that a use like this will destroy and hurt community. And what it reminded me was the 3 different variance settings I've sat in on as a community member when the identical variances were presented. The one I'd like to cite was one where a new halfway house for the chemical dependency was offered in our community. And at that meeting, there were about 50 people. And of those of us who spoke, that alternated between for and against, and everyone in favor of that was an individual whose home bordered or was nearby an existing halfway house or similar structure. And each of those people who spoke against accepting a halfway house were the people who were operating other halfway houses and really wanted a stronger residential community and not all people like themselves. What I took away from that is that the fear of property value losses and blight on a neighborhood may happen in parts of New York, but in terms of the Twin Cities, or at least in my case, the near downtown areas of St. Paul, exactly the opposite were true. They were seen as a stabilizing effort. So I found myself, without knowing the details, tending to I strongly lean toward thinking of this as a great use because of 2 things. One, it stabilized Bethesda for at least 18 months. And 2, it would help mobilize a community that had always assumed the same old would always be the same, and now would have an opportunity to, 1, pull together, and secondly, begin to look at the idea of what, or at least imagine after the pandemic, how will they optimize their community? And the opportunities are immense for that site. It's really an incredibly terrific opportunity. So I'll stop.
Thank you so much, Mr. Lentz. Dr. Bean, please go right ahead.
Hello, everyone. I would just like to mention that, beyond the bureaucracy and the discussions on property values, just a reminder and just to remember that we're dealing with human lives here. And I ask that, when we look at under C, that this project and this location is consistent with the health, safety, comfort, morals, and welfare of the inhabitants of the capital area of St. Paul, just remember that our houseless neighbors are residents, regardless of when they moved here. And I say that as a Dakota person. Statistics of who is homeless show a high number of people of color and indigenous relatives amongst these groups of people. And when our neighbors and relatives are not receiving the most basic needs of what, when their most basic needs are not being met, this is when we see an uptick in crime. And I think that we have seen that as somebody who works in downtown St. Paul, I've seen that uptick in crime when people do not have their needs met. And so, this is a direct response to that. And I think it is an attempt to meet the needs of our most vulnerable relatives who need us the most right now during a winter pandemic. And I just would hope that we would all remember to have some compassion and to think about the lives here.
Thank you, Dr. Bean. I appreciate your comments. Ms. Belton, please go right ahead.
Sure. Thank you, Madam Chair. Well, I would just like to say we have an opportunity to do something good here, and I am in support of this variance. And the 6 points that were argued and set out in the letter, you can argue for or against any of those. And so it's just a matter of different perspectives. I am a practicing architect, and I had an opportunity to plan a women's shelter in Minneapolis. And unfortunately, it did not go through because we did not have a good idea of what the community had to say. And that's not the situation here. Here we have a willing property owner, we have support from the county, we have identified practices of what works well and what doesn't. We have money available. And so we have an opportunity here to work together to help this community that's so vulnerable. And you know, and as an architect, I would say that the use of the hospital is a reasonable use to transition into a shelter. You don't have a lot of capital expenditure in order to move this population into this space, so that's a plus. And then also just in terms of the architectural integrity of the building, we're not doing anything on the exterior of the building, so so that's kind of a moot point. But you know, truly, we're really talking about the perception of who is going to be in this space. And you know, working on this shelter for me, I really learned a lot about the lived experience of people who are experiencing homelessness. And we have a lot to learn. We have a lot to learn from this population. And I just feel like, you know, we have an opportunity to provide secure, stable help to this group of participants. So I am in support of this variance.
Thank you, Ms. Belton. I appreciate your comments. Senator Nelson, please go right ahead, but I would ask you to try to keep it as brief as possible, as we have still have additional items to get through. Thank you.
Oh, yes. Thank you, Madam Chair. Just very briefly, just to be clear, that the question is not whether the Ramsey County proposed use is reasonable. The requirement for a variance is that there is not a reasonable use. So I think there might be a misunderstanding there, but I would just note that I believe we should lay this on the table and certainly have Senate Council take a look at the letter that Ramsey sent early this morning. I think it's important. Obviously, we know this is important to Ramsey County. They've done a lot of planning since September regarding this, and we know this is important to Bethesda as well. I also note that the CAP staff has not recommended this project. I think it's very important that we allow an outside counsel to determine if this project actually does meet the variance requirements. Rep. Hertas eloquently explained why it does not. I do not believe it meets the requirements for a variance either. Now, that is not to say there is not a need. There is a need. There is a need for homeless shelter. However, it does not meet the variance requirement here. There are other options that we could explore. And even Rep. Hertas put out an option that might even, I still don't know though, that would meet the variance requirement. So I move that we put this on the table, allow a Senate Council to take a look at this. And I tried to get a response today, but getting it so late just did not allow for a response from outside counsel. I think that's our due diligence. We owe that to the neighbors as well, and I think it's our due diligence as leaders to make sure that we've had some outside counsel looking at this as well. So, Madam Chair, I would move that we lay it on the table. However, if there are others who want to speak first, I do not want to deprive them of that opportunity, but I will be moving to lay it on the table.
Paul, I would defer to you quickly because I believe this is a non-debatable motion.
If the motion is to table, that is non-debatable. That calls for a vote.
So, Madam Chair, with that, if there are there other members who want to speak?
There are other members who would like to speak. Are you going to hold your motion until?
Yes, I will, Madam Chair. I think it's important that everybody have an opportunity to voice their concerns or thoughts. So just know that a motion will be coming. Thank you.
Thank you, Senator Nelson. Mr. Lentz, go right ahead.
I just wanted to address the one issue of adaptive reuse for hospitals. It is a specialized form of construction that's very difficult to find new uses for. And as the idea of someone creating an entire program for rehab, seniors, homeless program, and finding funding for that, having worked on establishing and finding and helping to create healthcare programs to go in existing buildings, I assure you that probably none of us will live long enough to have those found and funded.
Thank you, Mr. Lentz. So I would like to make some comments here before we move forward. I would like to associate myself with the comments from Representative Dean and from Dr. Bean specifically. I appreciate the points that have been brought up here. The pandemic, we've never been through a pandemic before in our lifetime, and it has certainly created unique circumstances. I wish that I could tell you that we did not have a crisis with our relatives who are experiencing homelessness before the pandemic, but it certainly has been exacerbated by the pandemic in this moment that we find ourselves in. You know, this is a time-limited proposal, and I think that is an important thing to consider as we are responding to the need. And I would just mention that much of my time over the last 10 months has been working in partnership with folks across the state to respond in creative ways to the need to our relatives who are experiencing homelessness in this moment. The need is very real, and I think for several folks who have said it as part of this conversation, just being in community as we drive through the streets of no matter where you live, frankly, people are experiencing homelessness in greater Minnesota. It may just look a little bit different. But I would say that as a board, we have to make this judgment call. This is our role, and would encourage us to do that today. But I also can say that I am very encouraged by members of both the Senate and the House who are participants within the CAAPB board, expressing concern and the need to support people experiencing homelessness in our state. I stand ready as your Lieutenant Governor, outside of my role as CAAPB board chair, to ensure that we are lifting up those needs and finding solutions to this issue that has plagued us for a very long time. So that gives me great comfort, and I am excited to do that work shoulder to shoulder with each of you. So with that, those are my comments. I will be voting, if we get to that point, in support of the variance. Senator Nelson, if you would like now to move to table this, you can go right ahead. Senator Nelson.
Thank you, Madam Chair. I do move that we table this until we have outside counsel look and see if the variance requirements are met.
This is a non-debatable motion. Is there a second? Is there a second?
Rep. Hertaus will second the motion.
Okay. Thank you, Representative Hertaus. So with that, we will go ahead and call the vote in support, we will call the vote with regards to tabling this variance for an upcoming meeting. So like usual, we will vote alphabetically. We will begin now. So a aye vote is in favor of tabling. A no vote is not in favor of tabling, is against. So Dr. Bean, please go right ahead.
No, I am against tabling.
Alicia Belton.
No.
Representative Dean.
No.
Elaine Fink.
No.
Don Grundhauser.
Aye.
Representative Hertaus.
Aye.
Ted Lentz.
Aye. Oh, no, I'm sorry. Beg your pardon. I'm reading the wrong line. No.
All right. No, thank you. Noted. Mr. McLean.
No.
Senator Nelson.
Yes.
Senator Pappas.
No.
Daniel Yang.
No.
And I, Chair Flanagan, vote no. The motion to table is not approved. So with that, members, I am going to move us forward through the next piece. We've been very in depth in our conversation, and I appreciate that. And I want to make sure that we are going to move right along here. So thank you for an important and robust conversation. I am really appreciative. It is clear that people have been thoughtful and thorough at this issue at hand. So in this moment, yes, I'm seeing a question in the chat. We do not conduct business in the chat, so I'm going to read it out loud, which is the motion fails.
Madam Chair?
Yes, Paul, go right
Paul
ahead.
here. Technically, we've just moved not to table it, but we have not moved on the variance.
Correct, and that's where I was headed. Thank you. Representative Dean.
Yeah, I was just going to say, are we going to go for a vote, or was there going to be any closing comments before we actually voted? I mean, just for the public, I don't think this is one of those votes that's something that all of the board members have not given much consideration to. And as mentioned earlier by board member Belton, that, you know, the interpretation of this is, it's sort of what we bring personally to it. And for those of us who have been out in the field regarding variances, regarding conditional use permits and all those other types of things, we bring a perspective that's one perspective, and other individuals like Mr. McLean and Dr. Bean bring different perspectives. And that's one of the great things about this board, is we do have many different perspectives. And I just look forward to moving on to further discussions in our meeting.
Thank you, Representative Dean. So I would ask for a motion to move the variance, to vote on the variance. Staff will put up the motion language on the screen. If you're going to make the motion, please reference the language provided here. Is there a motion to approve the variance?
Madam Chair, I would like to make that motion.
Thank you, Senator Pappas. Is there a second to that motion?
Elaine Fink would second that.
Excellent. Thank you, Ms. Fink. I would now open it up to any additional comments before we vote. Senator Nelson, I see that your hand is raised. I wanted to check in and see if you had anything to add here, or if you just left your hand raised on the hand raise function.
No, nothing to add, Madam Chair.
Okay, thank you. And Senator Pappas, your hand is also raised. I just want to make sure that you, and now it's down. Thank you. So there is a motion before us, member. So right now I would like to call the vote. So we will now vote on the motion before us, which is to grant the zoning variance. The exact text of the motion is before you, and I will begin again alphabetically by last name. Dr. Bean, how do you vote?
I vote to approve the variance.
Thank you. Ms. Belton?
Aye.
Representative Dean?
I vote yes.
Ms. Fink?
I vote yes.
Mr. Grunhauser?
No.
Representative Hertaus?
No.
Mr. Lentz?
Yes.
Mr. McLean?
Aye.
Senator Nelson?
No.
Senator Pappas?
Yes.
Daniel Yang?
Aye.
And I, Chair Flanagan, vote in favor of the motion. There being 9 ayes and 3 nays. The motion passes and the zoning variance is granted. So thank you for that. We will now move to the consideration of the conditional use permit. Like the agenda on the variance topic, we will start with a presentation from staff, We will then hear from the co-applicants and from members of the public before moving on to the board question and answer discussion time. We will close with a vote on the conditional permit. I'll turn it over now to Peter, and I would just remind everyone that we need to try to stay on time, and we still have additional information before us. So with Peter, take it away.
Thank you, Madam Chair. The conditional use permit, wait for the slide to come up. Thank you, Linda. Thank you, Madam Chair. The conditional use permit has criteria the application must meet in order to obtain board approval. In this case, this duty of the board today is to make a judgment as to whether the criteria have been adequately satisfied, and if so, that the proposed conditions are also acceptable. The 30-day time frame of the variance has afforded CAP board staff an opportunity to structure the following outreach to community members in order to gauge their concerns and allow for creation of 8 conditions proposed by CAP board staff that address the proposal. Next, I will overview those conditions, and then I'm pleased that we have Director Ricardo Cervantes of City Department of Safety Inspections and Commander Jeremy Ellison of St. Paul Police Department Central District present today as resources for you and can provide answers on specific issues such as building readiness for the proposed use, security, and best practices for shelters. First, a summary of the 8 suggested conditions found on pages 8 and 9 of your board memo. The first condition addresses fidelity to the application and permit conditions. The second sets in place a time limit through May of 2022 for both the conditional use permit and the associated variance. The third addresses on-site encampments. This fourth condition sets in place expectations that 2 security-related plans are filed with CAP board, both a facility security plan and a neighborhood safety review conducted in collaboration with CAP board staff, St. Paul Police Department, and Capitol Security. Fifth condition addresses the provision of a public contact number for on-site non-emergency issues. Sixth condition establishes that the facility continue to establish and post and enforce hours and rules for the use of the garden and grounds. The seventh, similar to the fourth condition, requires that an operations plan is filed with CAP board ahead of opening. And finally, the final condition requires participation in a stakeholder group convened regularly by CAP board staff to review issues collaboratively with a group of neighborhood and security representatives. And so next, we have Director Ricardo Cervantes of the city's Department of Safety Inspections, who was able to provide the board with 2 of the memos contained in your packet, and will now briefly address building readiness and then some specific best practices.
And Madam Chair, Paul
Yes,
Mendel.
Mr. Mendel. Mm-hmm.
Given the interest of time and the fact that we also have the public that still wants to address this, if Mr. Cervantes could keep it as brief as possible, given that his memos have gone out in the board memos to both the board and others interested, that would be much appreciated.
I agree, Mr. Mendel. Thank you for that reminder.
Director Cervantes.
Thank you, Peter. Board members, thank you for this opportunity to address you and provide you some background information. Again, I'm Ricardo Cervantes. I'm the director of the Department of Safety and Inspections with the City of St. Paul, wearing a couple different hats today, but primarily I oversee, the trades and construction area as well as our zoning application here in the city. We have a fire inspection program in the city, which is also related to this work. We believe that the Bethesda facility is well suited for a shelter and the social services needed for our unsheltered residents, and would provide respite services for the unsheltered individuals recovering from COVID-19. In the 2 memos I have provided, I wanted to lay out kind of what the process is in regards to the two areas that we're responsible for. First, in primary, is for the code and fire codes, the building codes and the fire codes that are being proposed in the use of this facility. And then second is really to just draw upon the broad experience from the city in our involvement in review and approval of other shelters within the city. I'll say that I personally have been involved with at least 8 different projects this year. You know, we are in this emergency state, this pandemic, and the city has been working very closely with Ramsey County. Ramsey County has commissioned an experienced architect, BWBR, to perform the code analysis of this building in order to convert its use. We worked very closely with this architectural firm in the past, and we would be working to achieve a performance-based design. That means that not only are we looking at the safety elements within the facility, but we're also looking at the programming as well as the location, security, configuration, and the ability of whichever provider is going to be providing those services is going to do it in a safe way. You know, we're beholden to the state building code. Chapter 13 allows for the city of St. Paul to achieve equivalence in regards to both the requirements of codes, but also how those codes are applied in this perspective. I want to also just highlight some of the key elements that we've highlighted in regards to successful shelter. Again, that's a much broader perspective, dealing with the location, physical building attributes, the operation, the programming, as well as the security. And we believe that the proposal that's before us now, it has not been approved. It has got all of the key elements that we believe are going to be successful in achieving this performance-based design approval. The piece that we will be scrutinizing is the certificate of occupancy. So upon completion or favorable approval of the land use, we would then complete that work with the consultant to ensure we have both the operational plan, the business plan, and emergency plan before we would issue a building certificate of occupancy. And I'll stand for any questions.
Thank you. And I would also introduce Commander Ellison, if you will turn your video on and simply say hello. And we both have both Director Cervantes and Commander Ellison available onward today also to answer questions during your discussion.
Yep, good afternoon, everybody. My name is Jeremy Ellison. I'm the Senior Commander for the Central District.
Great. Thank you so much for those comments. I think just in the interest of time, Peter, let's go ahead and move right into comments from the public, and then we can open it up for any questions from CAP board members.
I simply want to point out that I think there was some remaining, I could be corrected, Paul, remaining presentation.
I believe the county had a little bit more, a few more slides relative only to the conditional use permit, Madam Chair.
Great, thank you. And I would just ask that the county be as brief as possible. Thank you.
Thank you, Madam Chair, board members. Again, I'm Amy Schmidt, an Assistant Ramsey County Attorney. I will be very brief. On the conditional use permit, the criteria were up there before. The first two are the key. I think that based on the discussion related to the characteristics of the property, the proposed use, and the plan, that the county does meet those two criteria. The question of an adverse effect on the general character of existing uses and affecting the beauty, dignity, and architectural integrity. We're not changing the building from the exterior. There's a security plan in place, as we've been discussing, and so with those protections in place, the county meets the first two criteria. The third criterion is basically about the conditions. There are, as staff indicated, there are 8 conditions that have been proposed, and the county stands ready to comply with those conditions. There's one of the conditions we've already actually met. Conditions 1, 2, 3, and 5, if you could go to the next slide, please. Conditions 1, 2, 3, and 5, the county doesn't have any issue with. No modifications are requested. Condition 4, as I say, we've complied with part of that condition already. And then condition 7, we have already met with the operations plan having been submitted. We do have a couple of requests as to modification of the proposed conditions, specifically on conditions 4 and 8. The actual actions that are requested as conditions, the county is ready to comply with and participate in. We only ask that there be a change as to the timing, that there be as the conditions are currently written, they would require that the county satisfy the conditions completely prior to issuance of this conditional use permit. And we would simply ask that there be no delay in issuing the permit until those things happen. I mean, we will continue to do all of the required steps to comply with them. We just simply wait or ask that there not be a delay in issuing the permit. Condition 6 is the last one that I'll mention. We would request that one be eliminated. It relates to the posting of signs in the private garden area prohibiting alcohol, firearms, and illegal drugs. It's my understanding that Fairview, our Health East, already has signs in that area prohibiting alcohol and firearms. And simply putting up signs to prohibit illegal drugs is sort of redundant. They're illegal, and it's not something that is really necessary to compliance by the county with the conditions. Unless county staff have other things that they want to add, I'll stop there.
Thank you, Ms. Schmidt. Peter, I believe now is the time when we would turn it over to public input. Oh, Senator Nelson, I see that you have your hand raised.
Oh, yes. Madam Chair, when would be the time for board members to add some conditions for this conditional use permit?
I'd like to get through the public comments and then continue to have that conversation at that time.
Thank you.
Thank you. Mr. Musty, go right ahead.
Thank you, Madam Chair. We have 2 more groups from the community that have stepped forward to speak today on the conditional use permit and conditions. The first is Hannah Hills, representing the Capitol Heights Block Club. Hannah, are you with us?
I am. Thank you. Can you hear me well enough?
Yes, you sound great. Go right ahead.
Thank you. Madam Chair and distinguished members of the board and staff, thank you so much for this opportunity to represent our neighborhood. First and foremost, our block club would like you to know that the general feeling right now is that of whiplash. The aggressive and quick nature by which the county has been moving has been really disconcerting. We understand the gravity of the situation, but there is so much that our neighborhood also feels. If you read Appendix F in your handout, you would see a report from the county on community engagement. The continued assertion that town hall meetings or listening sessions has not been our experience. We felt it was more of a marketing presentation. And we, as a block club, I would like to formally say we're never approached by county commissioners or staff. So small group and one-on-one sessions, to my knowledge, did not occur with any representatives of the immediate Capitol Heights neighborhood. Our stance right now is that we do not oppose getting people off the street. Obviously, this is a very important issue. We are struggling with the response of the county to our concerns. Some of our streets have finally been seeing a decrease in crime after years of diligent work by residents and law enforcement, but other streets, mostly near Rice Street, have been dealing with increasing crime and violence. The liquor store on Rice has a crowd waiting for it opening every day. How can the county turn a blind eye to the effect of bringing in a large transient population, many of whom have chemical dependency issues, and offer no proactive solutions or engage in meaningful community dialogue with the people living just steps away from this facility. So as the board's responsibility is to the capital area, you are upholding that by going through this process, but we ask that you continue to uphold it by thoughtfully considering these criteria for conditional use, for the conditional use permit. At this point, one of the residents brought up that we have policy and we have engagement. We're currently in the policy phase, and our community does not have confidence that the county has our best interests at heart. We have not experienced them acting in good faith or prioritizing being a good neighbor, and we desperately want that. We desperately want to work with them, but we continue to not feel that. Regarding the plan, we see a lot of vague language, and we just don't feel comfortable with vague language in a plan that is going to dramatically impact our neighborhood. I would like to state that one stakeholder in the group that was convened brought a measure of hope when she pointed out that conversations for the neighborhood improvement have been happening for years, and now there's finally more voices being brought to that conversation, which is a very positive thing. So I'd just like to draw your attention to 4 things. I was listening to the first part of this conversation, and I would just like clarification on the low barrier status. We have understood that that is taken away, but it is not 100% clear. So please, we would like that addressed. In a low barrier setting, we understand that clients are allowed to be under the influence in the facility, but not allowed to use drugs and alcohol on the facility grounds. If this is the case, I don't see how by default you are not then forcing them into our neighborhood to engage in the act of using drugs or drinking. Which leads to our second and third concerns, which are the spillover from activity and the security, which is not just for the grounds, but for the whole neighborhood. The facility previously housed hospital residents who were not coming and going from the facility. A shelter would bring a large transient population. It's not just housing for 100 people plus the COVID beds. It's a rotation of 100 people. That's an incredible increase of bodies coming in and out. And we agree with establishing a good neighbor group. We strongly desire to see Ramsey County committing to improve the neighborhood by being a good neighbor. I've seen today, and I have read in the past, just how much politics are involved in this. It's really disheartening as a resident to see how much politics are involved in this issue. Squabbles over jurisdiction are hurting residents and even allowing space for the recent murder that took place on Rice and Sherburne. So as a resident, I want to know how the county and city can start working together on a better way to actually improve the area. Stop playing politics and passing the buck, please. We believe that the board has an opportunity to require that changes be made with these conditional conditions for the conditional use permit. We have ideas for how this could happen, from helping the storefronts along Rice Street to working with SPPD, Metro Transit, and Capitol Security to create a public patrol force to police within the capital area. And at the very least, using the private security personnel hired by the county to expand their duty by 1 block, just to be a good neighbor and help keep that safe. Obviously, it's been brought up that homeless people are more likely to be the victim of crime perpetrator than the perpetrators of crime. If we follow that logically, then it's fair to assume the population that is attracted to victimize homeless people will be in closer proximity to them. This means in our neighborhood. So even with the transitional living communities within, I know that there's been nitpicking over how far away they are, but we know that the police calls and crime increase with this population, even if the residents are not the perpetrators of the crime. We need reasonable acknowledgement for the potential in an increase in drug and alcohol abuse and other illegal activity in the area directly around the grounds of the facility, and we need a plan to proactively address it. The county has not provided a plan that seems in a way that will quantify and measure what's happening in the neighborhood and then be able to change what is happening accordingly. And finally, I know it's not a popular thing to bring up, but issue of property values. Michael Meneghy addressed the research that was contested, but our neighborhood is being asked to shoulder a great burden, and we are being offered nothing in return. There's been no outreach from the county with an empathetic ear. So one idea that we have had is use the minimum amount that research has been showing properties reduced by, which is 17% within 1,000 feet. And we would like to see property values within 1,000 feet of Bethesda reduced by 17%. We think that would be a very simple way to show the neighborhood that you understand the impact that this could potentially have. So yes, to conclude, we would like clarification on the low barrier portion of this this proposal. We would desire for the county to commit to the good neighbor standards, and we would ask that the timeline in the original proposed conditions be before they receive the permit, because again, we don't feel confident that they in good faith will participate. And then we desire to acknowledge the burden they're placing on the neighborhood and offer something in return, namely a decrease in property taxes. Thank you for your time. I'm sorry it took so long.
Thank you, Ms. Hills. I appreciate it. I would ask the county to, as you're able to answer and respond to those questions, but after we have completed the public comments. I believe we have one more. Peter.
Madam Chair, the second set of speakers is a joint set of perspectives from Education Minnesota. They are located at Cedar and Sherburne. We have Sarah Jerdrum, Londell French, and Shane Patrick here. And Sarah, please take it away.
I'm sorry, Sarah, you're on mute.
Yes.
Still muted. I bet they got like a.
Okay, does this work? Thank you so much. So thank you for the opportunity to speak, and I'll be brief also. I'm here with my two colleagues, Shane Patrick, who's our Director of HR and Facilities Management. He has some details he'd like to offer, and then my third colleague, Londell French, who's our equity organizer, but in his off-duty hours, so to speak, he's on the Minneapolis Park Board and has worked relentlessly over that last year with the unsheltered folks in Minneapolis and the encampments there, so brings a lot of expertise around that. So as you know, Education Minnesota is probably the largest and closest neighbor to the facility. We have 80 staff in normal times who work in that building day in and day out, and we represent educators across the state, 86,000, and we have numerous members every day coming in the evenings and coming on the weekends for meetings. So I want to echo one of the comments from Hannah is, first and foremost, we want to be a good neighbor. We want to support these unsheltered folks in this facility, and we want to support our members and staff that feel safe and prepared for the unsheltered folks coming into Bethesda. And with that, we are planning to offer training to our staff around what does it mean for folks who end up in a shelter, and how can we be responsive and helpful and smart to support them. The second thing we're asking for is we really want to be partners in proactive communication. I think Hannah mentioned the kind of speed at which we're trying to get all our comments in, and what that does is not allow for us to be as proactive thinking about potential issues. And as Londell and we at Education Minnesota have had conversations, there are things that will arise that we can think about ahead of time based on previous experience. I especially appreciate the comments and the notes made by Mr. Cervantes and what the county has observed. We would appreciate that, as well as other observations from the encampment issues in Minneapolis. So with specific details about what we're asking for, I'm going to turn this over to Shane for just a couple minutes to look at the specific things we are asking, especially related to the parking ramp, where we have a contract for parking for overflow for us. So Shane, could you step in, please?
Thank you. Am I okay to proceed, Madam Chair?
Yes, please go right ahead.
Okay, I will keep this brief. Understanding completely that the recommended list of conditions is not all inclusive, there are a couple of things that we did want to point out to make sure that everyone in the community, as well as the board considering, would be aware of. One of them is Sarah had pointed out is the conditions of the adjacent parking ramp and our direct concerns regarding the parking ramp lighting and or the presence and absence of any video camera monitoring system that would be useful in maintaining a safer environment in that parking area. The request would be that not only is it monitored, but that someone is able to respond, particularly someone who is trauma informed as part of the security team. The second point I wish to speak to relates to condition 4, specifically bullet 2 and condition 8 to a degree, talking about how we all understand the variety of circumstances that may contribute to the increase in unsheltered population. And we just want to underscore that there is a significant concern that we share with the community regarding people who victimize or prey upon the unsheltered community, and understand that there can be an impact to those who are receiving services and are the guests of the Bethesda facility. And we want to be an active partner to help create that community support to help protect the people who are receiving services from the Bethesda facility. And what we ask is that we be part of an ongoing review process as part of the community to be able to have conversations and discuss the protocols on a regular scheduled basis. And then my last point to speak about is kind of a continuation on that, but deals with the communication as outlined in condition 5. We ask that the group of site management for Bethesda, as well as the CAP board, Capital Security, the Fairview System, and Education Minnesota, as well as members of the community, have a way of having a real-time, ideally two-way communication method with protocols in place for situations that may arise. We understand that situations can arise anywhere within our neighboring community, and the best way to be proactive is to have open dialogue and communication as quickly as possible about any situations that may arise or that we've experienced. And we want that to be a two-way communication. We also can experience situations that arise here, being adjacent to the Capitol and being part of the education system. And we want to be able to communicate that out to each of our partners as well in the community. So just consideration about how that might work, whether it be a text alert or push notification system to key players representing each of us, Education Minnesota, as well as all the community partners as discussed. Thank you very much.
Hello. Thank you, Madam Chair, for allowing me to speak. My name is Londell French. I'm an racial equity organizing specialist at Education Minnesota. I kind of want to repeat the theme of Education Minnesota wants to be a good neighbor. We are right now trying to figure out a way to do some trainings for our workers, for our staff on some of the issues that address homeless folks who are unsheltered. So, you know, almost like a cultural competency training for folks who are unhoused. I think it's really important for folks to understand that, like, when we talk about low barrier and barrier shelters, if you don't have low barrier shelters, folks won't go and they'll die. They'll die outside. And so being a good neighbor means we'll understand some of these nuances and these issues and these problems. And I think the way we solve a lot of the problems that will happen, and they will happen, is be proactive in our communication with each other. We have to talk to each other and figure out, you know, this is something that could happen. This is something that might happen. This is something that's going to happen. And let's be real about it. And we are trying to protect some of the most vulnerable people in our society and in our culture. It ain't perfect. We're going to make some mistakes, but hopefully we won't have people dying in the streets. And that's what's going to happen if folks don't have places to stay. Thank you, Madam Chair, for allowing me to speak. I appreciate it.
Thank you very much. I'm wondering if there is, I know that folks have asked specific questions of the county. I would like folks to be able to respond as they're able. So Mr. O'Connor, did you want to speak to some of the questions that have been raised?
Sure. Thank you, Madam Chair. I'll try and address the main topics. I was trying to take some broad notes. And if there are pieces that I don't fully get, I apologize. Be happy to answer as we go. There are 4 topics I wrote down. I'll start with that issue of partnership that Mr. French just ended on. I appreciate that it was expressed by all speakers. I take it very seriously on behalf of the county. I know our elected officials do as well, to work hard to be good partners. We live in this community. We care about this community deeply as well. We are all residents and in service to Ramsey County in our role through our professional work and our organization. And to the end of partnership, I think part of it that I just would say is, as we have worked this summer at Luther Seminary, we've been doing the work around the St. Kate's campus, as we've been doing work around multiple hotels around the area, as we've worked downtown around Mary Hall, as we've worked downtown around the Ramsey County East Building. We have had these conversations across neighborhoods this summer in Minnesota, in Ramsey County. And I think if you would go and ask those neighborhoods how they feel, they would say there have been times when we have had to work our way through issues as they arise. I'm not here to tell you there's never been something that's popped up we've worked through, but I think they would tell you we've been responsive and the outcomes have been solid and people are feeling good about the approaches that have been taken. And I don't say that lightly. I say that because we've had to learn and grow as we go, and we are looking to do that with this neighborhood as we go forward. In the area of communication with neighbors that got brought up throughout, I just want to note we do have 2 contacts that are receiving every Friday messages going out broader to the community as well, but we set up a specific liaison point with the Capitol Heights Block Club. I don't have the names of the 2 individuals right now. We have done that since the beginning. I could provide that to Ms. Hills as a follow-up, but part of our intent was to ensure that communication has been happening. I'm sorry if that hasn't been getting to Ms. Hills, and I would like to offer, coming out of here, we are doing an every Friday email out into the community, trying to update on everything happening across homelessness, and it's important to us that we do share as much as possible, and that would be an offer I want to make as a follow-up. The idea around additional restrictions, I would go back to the partnership piece. My biggest concern becomes every condition you put on, particularly if they have timelines, will prevent the movement of people into stable housing on a rapid timeline. And it's not an intent issue. We do not want to sidestep the important conversations raised, but that's something I would ask that the board to consider. As we've worked with St. Paul and the other sites I mentioned, St. Paul has had a practice of not placing conditions, which isn't to say they don't care or that we're not working together. It's to say that there's a mutual trust to getting to good answers here and an idea that we are here to work together, and that's been important. And I'll end on the part about values. I appreciate hearing from everybody that we share the same values. There are other people that call us when they see encampments show up in their neighborhood. We had 3 tents burned to the ground last week in very dangerous moments. There was a very hot phone call that we were a part of this morning about the danger people are facing being outside with carbon monoxide and fires. And so I would just ask everyone to understand that we are not trying to do this to anyone in the neighborhood or anywhere else. We are just desperately seeking solutions with partners across this community. And I thank everyone for being a part of this important dialogue. Thank you, Madam Chair.
Madam Chair, I'm Paul here. Just
Yes,
one question that Ms. Hills did ask specifically was for a clarification between low barrier and step up.
Thank you, Paul. I missed that one. Sorry, Madam Chair. And to Ms. Hill's question about the clarification. So originally this was being looked at as the low barrier entry point into the system. That has since changed. The entry points in the system would be other shelters. I'll name Mary Hall being one of those particular sites where we've been working to think through our process and progression, in part trying to respond to some of the concerns around the neighborhood and trying to be as thoughtful as possible in how we can make a move. And so there is a piece here to where it requires this 7-day period of being in another space prior to making the move into the proposed Bethesda site.
Thank you so much for that, Mr. O'Connor. Representative Dean.
Thank you, Madam Chair. And I guess this is sort of a follow-up to your response, Mr. O'Connor. Will there still then be services for individuals in the site to connect them to whether it's chemical dependency, mental health, or other things, because the assumption is most of these people have went through the step-up program, so everything's fine, but we all know the perils of addiction and those other things. I just want to verify that you will continue to have individuals that can direct these people and connect these people to the services that they may need while they're in the Bethesda site.
Thank you. Madam Chair, Representative Dean, thank you for that question. That has not changed from before, the idea of services being provided on site. We have had an RFQ that has been out publicly, and there were, I'll just say, more than a dozen responses that we received. The evaluation is ongoing right now. I want to acknowledge that we had hoped that that timeline would have been 2 or 3 weeks faster than it has been, but we've been trying to move multiple pieces at once. But we fully intend to provide the services model as described at the previous meeting.
Anything else, Representative Dean?
No, that was it. Thank you, Mr. O'Connor.
Thank you very much. I'm going to move the conversation along here. And would just say to the members of the public who commented, I very much appreciate your comments and perspectives, and would just encourage, regardless of the outcome today, that both the neighborhood and the county continue to build robust communication and build relationships as built on the foundation of really caring for community, because that's a consistent thing that I have heard from all parties. So I appreciate that. Senator Nelson, go right ahead.
Oh, thank you, Madam Chair. I just wanted to bring up a couple other provisions for the conditional use permit that I
appreciate that, Senator Nelson. What I'm going to do as chair is to move us through each of the conditions. Individuals can express if they have concerns about those conditions, and if there's any new conditions, we will take those up at the end of walking through the 8 conditions and vote on those individually.
I can wait until the end.
Great, thank you so much. I appreciate it. And I know that we are running long, but I also think that this has been an important meeting to ensure that we are hearing from all of the parties and from the public as well. So we are going to go ahead and jump into these conditions here. Thank you again for sharing your thoughts and ideas and concerns. And I wanted to just specifically say to Director French, I know that you spent a tremendous amount of time thinking about and working on this particular issue. I appreciate your leadership and the creative thinking that Education Minnesota is using in approaching this response. So thank you for that. So it's clear that a lot has gone into these conditions from all parties, and I want to turn the discussion now to the conditions at hand and how we do or do not see them fitting into a potential list of conditions that the board might attach to a conditional use permit. In order to use our time wisely, I'm going to run through the list quickly to first determine the conditions where there is consensus. As I mentioned the condition, if you could please indicate by raising your hand if you have significant concerns about the condition. If I don't see multiple hands, we'll make sure, we'll make a note that there's likely consensus on that condition, and we will move on to the next. If I do see multiple hands, we'll make note of that condition and return for it to it for a larger group discussion at the end of this initial run through the list. Okay, hope I've made that clear. We'll start with the first condition. As a reminder, we'll have time to fully discuss any and all conditions after this first exercise. This isn't an official vote, but instead a way to focus our discussion. So, condition 1 is the commitment to the terms of application. It's on the screen in front of you here. Hold on 1 second. And I know it might be kind of small, and I assume that many of you also have it within Emmett is sort of making this all happen. You can maybe increase the screen size here, but you should also have it in your packet. So condition 1, is there commitment to the terms of, the application? Any concerns with this first one? Please raise your hand if you have any concerns. Okay. All right, condition 2 is the time limit on the CUP and variance, making them expire on May 31st, 2022. Any concerns? Do you see any hands? I don't see any hands. Okay. One hand in Jerry Hertas, thank you. We will come back to that. I don't see any additional hands. Condition 3 is the condition prohibiting encampments on the property. Are there any concerns there? And Representative Hertas, I'm going to ask you to take your hand down just so I can keep track of any additional new concerns. Thank you so much. So condition 3 is the condition prohibiting encampments on the property. Are there any concerns? I don't see any. We will move on to condition 4. Condition 4 is the security plan condition, which includes 3 subpoints, which you can see in the document. Are there any concerns? Okay. Senator Pappas, did you raise your hand? I just want to make sure I'm counting it if I can.
Yes, I did. It's hard to tell when it's raised.
For sure. So I see a hand raised from Senator Pappas and Representative Dean. We will absolutely come back to that. If you could now lower your hands as we move forward. Thank you. Where am I? Okay. Condition 5 is the 24/7 communications condition. Are there any concerns? Okay. Condition 6 is about posting signs about rules in the private garden. Are there any concerns? Okay, I see Representative Dean's hand raised and Representative McLean's hand raised. And Senator Nelson's hand raised. We will come back to that one. Thank you. Condition 7 is about the operations plan needing to be submitted to the CAAPB board prior to the issuance of the permit. Are there any concerns? Senator Pappas, I see your hand is raised. Representative Dean, I see your hand is raised. Okay, thank you. And condition 8 is about the community stakeholder group meetings, with the first meeting occurring before the opening of the shelter. Are there any concerns here? Excellent. Yep, Representative Dean, Senator Pappas, Ms. Belton, I am also raising my hand to that one as well. Okay, excellent. So we will now go back. Emmett, condition 2. Okay, is the time limit on the CUP and variance making them expire on May 31st, 2022. Senator Pappas, please go right ahead.
I don't believe I had my hand raised on this one. I think it was Representative Hertas.
Oh, okay. Sorry, I just saw your hand. Representative Hertas, please go right ahead.
Thank you, Madam Chair. And because of the urgency of this situation and the manner in which this is being approved and its presentation as a temporary solution, I think that item 2 needs a little bit stronger language and clarification that it is just that the CUP, both the CUP and the related variance cannot be renewed, that there shall be a minimum time elapse before any other such continuation of the temporary use would be allowed to continue. I offer this in assurance to the neighborhood and to the folks that have an investment in that area and community, are guaranteed that that this truly is just a temporary fix while the county figures out a better plan to deal with the homeless situation. So I would recommend that that the language be cleaned up. Both the CUP and the variance expire on that date, and there be a minimum of 5 years before any other such application would be considered as a continued use.
Thank you for that feedback, Representative Hertas. Does anyone else want to speak to condition 2 and to that suggestion? Representative Dean.
Thank you, Madam Chair, and thank you for your comments, Representative Hertas. I like where this is going. I think that in the end, you're actually taking a huge sledgehammer to try to address something that could be done a little more graceful. And I would suggest that instead of saying that nothing could be done for 5 years, that should a continuation of this project be considered, it would need to come back before the Capital Architectural and Area Planning Board for reconsideration.
Thank you, Representative Dean. Senator Nelson, go ahead.
Thank you, Madam Chair. Well, to that point, Representative Dean's suggestion is already what would happen. These would not be extended without coming before the CAP board. But I was thinking about the same, along kind of the same lines as Representative Hertas, although I had a bit of a different take on that. The same idea, though, the fact that this has happened, you know, the county's known about this grave issue for a long time, and yet, you know, things were just like thrown out, or should I say came together here at the very last minute. And we certainly don't want to see that happen again, not only for the residents of the neighborhood, but the shelter residents as well, and the Capitol community as well. And so my suggestion is that to avoid that type of last minute planning or not having an answer as the end draws near to May 31, 2020, that there be a plan update to the CAP staff on a regular basis. I would suggest at least once a month. The staff might have other input on the timing, but I do not want the CAP board or the staff for that matter, or the residents or the shelter residents to once again have planning not in place well ahead of time. And now there's a concrete deadline here, and we would expect the county to have ongoing plans to meet that deadline for an alternative situation. And so I would request a update to the staff by the county on their new plans on a regular basis, and I'll leave it to staff to determine how regularly that should be. I would suggest a month at this point, but certainly open to, if monthly meeting is not the right time, a different amount, but certainly regularly mandated updated reports from the county.
Madam Chair.
Thank you. Yes. So I'm going to go to Representative Hertas first, and then Paul, I will hand it over to you, and then to Senator Pappas.
Thank you, Madam Chair. And the reason I put in a deadline, and respectfully, Representative Dean, you have articulated the very anxiety and concern that the constituents who reside in the area have expressed. The manner in which you're approaching this is clearly showing a pathway in which this will not be a temporary use of the property. By leaving that door open, you are taking away the assurance that's being made at this time that this is a temporary use. By having a hard prohibition for a minimum period of time, pick the time, I'm flexible on the time, but this forces Ramsey County and those who are necessarily needing to address and come up with a plan for the homeless have to face the reality that something needs to be done, and certainly would light a fire under this issue politically. But it is not fair to sit here and approve these variances in a conditional use permit and represent to this community that this is a temporary use, and then you leave the door open to extend that use for whatever period of time. So if it's truly temporary, let's make it temporary. Thank you.
Thank you, Representative Hertaus. Mr. Mandel, I'm going to come to you, and then I'm going to come over to Senator Pappas. Mr.
Yes.
Mandel.
Madam Chair, when we made these recommended conditions on this one, the county does not have, after May of 2022, the county is no longer in possession of this facility. As a planning body, we would certainly hope that by that time, mHealth Fairview has plans for reuse of the building, but clearly anything by the county of a reuse would have to come back to the board. That's automatic. But I would think it's up to Fairview to come up with some plans by that time as the owner. And once May comes, the county no longer has a role in the building.
Mr. Mandel, that's a helpful reminder of who is the owner of the building and property. Thank you. Senator Pappas.
Thank you, Madam Chair. I just wanted to state that I think the language is clear and that anything else is extraneous. Obviously, we can always ask Fairview or ask the county if they continue to rent the building, for what purpose. You're right, they have to come back to the CAAPB board. And I think the language is fine the way it is, and I would support it staying just the way it is.
Is there any other discussion? Representative Dean.
Thank you, Madam Chair. And I think it's important that we're having this conversation. And the reason I think is important is there is actually nothing that prohibits anybody in the future from applying for a variance. And this discussion clearly sets a table for future CAAPB board members to understand what we discussed and what we actually approved here with the specific project. I think that that's where the critical nature of what we're talking about and why we're having these conversations are important. It's important for us, it's important for the residents at this moment in time, but it's actually more important for the future. Thank you, Madam Chair.
Thank you. I'm keeping track of hands that are raised. Senator Pappas, do you mean for your hand to still be raised?
No, I'm sorry. It's just the hand raising function just is confusing to me.
Oh, good. No worries. Absolutely. Mr. Mandel, go ahead. Mr. Mandel, your hand's up. Did you mean to have your hand up?
I was muted. Sorry.
Nope. Got it.
I was trying to unmute myself and unhand myself.
It's okay. We're getting punchy here at the end. It's all good. Senator Nelson, your hand is raised.
Yes, thank you, Madam Chair.
Third time's a charm. Okay, go ahead, Senator Nelson.
Yes, thank you, Madam Chair. Well, the issue is we do need to have this reporting language in here. We cannot put ourselves or the communities in a position on May 15th when the county will come and say, well, you know, we don't have another plan, and so we have to extend this, or we're going to see people thrown out on the street. I just don't think that that is how we should be doing something as important as shelter for Minnesotans. I don't believe there's any issue in, I don't believe there, excuse me, I'll just shut that off. I don't believe there's any reason why the county we are granting them a variance, which, you know, some of us don't think they qualify for, but they're going to be granted a variance. I think at a minimum, they should have to report to the CAAPB board on a monthly basis what is their plan for the next step. because clearly there wasn't a plan. It's a thorny issue. If it was an easy plan, they would have had one earlier. But that is why I think we need to have that transparency and that accountability. And so I would move that we, and I would ask staff, Executive Director Mandel to put in the exact language if we need to vote on this, that would require that timely, regular reporting to the CAP board on the county's process in the next plan, the next phase.
So there is a motion. Mr. Mandel, is there language that you would be able to provide here?
Madam Chair, I would suggest, looking at it, that in the interim time, I would suggest at least by this being December of 20, that by December of 21, we commence with hearing plans from, I would say, both the county, or the county and M Health Fairview, report with plans for reuse of the building after closure of the homeless shelter, or something like to that effect. Because in effect, it will close on May 31st of 2022 by law, if this is approved.
And Senator Nelson, I want to make sure that this gets at where you are going here.
Yes, Madam Chair.
Yes, okay. So this is a report by December 15th, 2021. The co-applicants must report to the CAP board proposed plan for the future use of the building after May 31st, 2022. Is that, does that satisfy your request as far as monthly updates? Are you okay with that timeline?
Yes, Madam Chair. I think staff has the best understanding of what time would be most important. So I think this language will fill the bill.
I will second that motion, Senator Nelson, and would ask for any discussion. Representative Dean.
Madam Chair, I was actually had my hand raised earlier, and the reason it was raised, I actually think a requirement of monthly reporting or every 2 months reporting would be best as a second or an additional condition. But I think this language sort of gets to what Senator Nelson, her concerns are, and I would be in support of changing condition number 2 to read as is before us.
Excellent. So let's go ahead and vote on this proposed language, and then I will come back to you, Representative Hertas, if there's additional proposed language that you would like to bring, make a motion to bring forward. So with that, there is a motion to change the language within condition number 2. As written in red, there is a second. And so I will go ahead now and call the roll in alphabetical order. So first, Dr. Bean, how do you vote?
Aye.
Ms. Felton?
I vote yes, aye.
Representative Dean?
I vote aye.
Ms. Fink?
Aye. Aye.
Mr. Grundhauser?
Aye.
Representative Hertas?
Aye.
Mr. Lentz?
Aye.
Mr. McLean?
Aye.
Senator Nelson?
Aye.
Senator Pappas?
Yes.
Mr. Yang?
Aye.
And I, Chair Flanagan, vote aye. So that passes. Thank you. Representative Hertas, let's come back to you. Is there additional language that you would like to propose or move be included in condition number 2?
Thank you for the invitation. I don't believe there's much support for adding a prohibition of continued use. I think this language would adequately address my concerns. Thank you, Senator Benson or Nelson for adding that language as well.
Thank you, Representative Hurtas. And I hear you on making sure that we need to continue to have communication and the community needing to know what is happening with this site. So thank you for that. I am going to look to Emmett, who is keeping track here of our numbers, and we're going to go to number 4. So number 4, folks had expressed some concerns with number 4, which is the security plan and resources. If you do have a comment or a proposal that you would like to make with regards to the language, I would invite you to please raise your hand and add to the discussion. Mr. Mandel, I see your hand raised. Please go right ahead.
Thank you, Madam Chair. Just a point of information for the board. We did receive a security plan from the county about, well, within the hour before, just before the board meeting. It's 15 pages. I have yet to get past the table of contents, but we do have one in hand. We also did receive 2 versions of an operation plan, those being over 50 pages each. So needless to say, I have not gotten past the title page on those.
Thank you for that, Mr. Mandel. I'm going to come to Senator Nelson, then Senator Pappas, and Representative Dean. Senator Nelson.
Well, thank you, Madam Chair. That's over 70 pages of documentation that came in since 3 a.m. this morning for this proposal. Just to note, maybe more. But my question, my comment has to do with security. 2 things. I mentioned them a bit earlier, and I think this might be the place to put them in, and if not, it might be elsewhere. But number 1, I do believe there needs to be transparent reporting about increases in crime, both level 1 and level 2 offenses, which need to be identified for their crime. I see we have a police officer on the call who could maybe answer the difference between crimes 1 and 2 in law enforcement reporting. That's pretty important. But we need to have that knowledge about a crime, not only at the site, but also at the surrounding site, which would be the neighborhood, and of course, including the Capitol neighborhood. And I know the St. Paul Police Department does have those crime statistics, and I do believe they are separated out by offenses that fall into level 1 and offenses that fall into level 2. And I do believe that's important to get both of those as an update to the communities, the adjacent communities. So I will ask staff member Mandel for language requesting those reports.
Madam Chair, condition number 8 calls on regular stakeholder meetings on a monthly basis to start with, and then if possible quarterly, but at least monthly in the beginning, where we've already had contact with Capitol Security, St. Paul Police, Ramsey County for their providers, etc., including the stakeholder groups, that we would come together on a monthly basis to update, and that kind of information would be some of the very material that we'd be sharing on a regular basis.
Terrific. We can wait until section 8 to put that in then. And you've answered both of my questions in that. So, but I will be seeking some language to put into point 8 regarding that, both level 1 and level 2 offenses. But we'll hold on till then. Thank you.
Okay, noted. Thank you, Senator. Senator Pappas, please go right ahead.
Thank you, Madam Chair. I am concerned about the weather. It drops down below freezing every night now, and I don't want to see any delays. So I don't know how long it'll take to issue the zoning permits, but if there is a delay, you know, the security plan is in hand. Obviously, it has to be reviewed, but I think we have to do these things simultaneously. Is that we need to move ahead today to allow the county to begin using the building as soon as they can, and not have us put up any barriers.
Thank you. So I believe I want to see if there's any more discussion here about number 4. It sounds like we can, if not, we can move on to number 8 eventually for these additional pieces here. Oops, hold on, everybody. I'm losing track here. Representative Hurtas.
Thank you, Madam Chair. Could you scroll, whoever's controlling the screen, could you scroll down a little bit? I wanted to get to the part with regard to the presence of drugs and alcohol and firearms. Was that part of this number?
No.
Representative Hurtas, that is part of number 6.
Oh, okay.
So
And by the way, I'm seeing on the margins here that the recording of this meeting has stopped.
Let's see. I see that it's still going, but maybe Mr. Mandel or Mr. Musty, could you comment on that, or Ms. Spohr?
Madam Chair, my screen says it's still going.
Okay.
And we have 2 methods of recording, so we can splice it together if it is not.
Yeah, okay. The live stream is still running, so that is another recording.
Excellent, thank you. So it sounds like we're covered on a few different bases. Representative Hurtas, thank you for that. And I will absolutely come back to you as we get to that point for condition number 6. Senator Nelson, I see that your hand is raised. It is now no longer, oh, it is raised. So go right ahead if you had something additional to add here.
No, Madam Chair, I'm just trying to lower the hand. I'll raise it when we get to the last point.
Great. Senator, I'm going to lower your hand for you. There we go. And Representative Hurtas, I see that your hand is still raised. Would you like to also have me lower your hand for you?
Yes, please.
Okay, thank you. So I don't think that there are actually any changes to number 4, and I'm not seeing any additional hands. So we will continue. Oh, Senator Pappas.
Well, Madam Chair, I don't know if I got an answer to my question about delays, because it says that they must present 2 security plans to CAP staff prior to final issuance of the zoning permits. So what does that mean? Have they received the security plans? Do they have to review them? And when will the final issuance of the zoning permits happen? That was
yes, Senator Pappas.
Maybe I was too pointed.
Go ahead. Thank you. I appreciate your question. And we actually, it does meet the requirements as those were submitted to us. They have not yet been approved, but they have been presented.
Okay, thank you very much.
Yeah, absolutely. Okay, moving right along. I think we're at number 6. Okay, number 6. We've got Senator Pappas. Your hand is raised.
I'm sorry, Madam Chair.
Oh, yep, Mr. Mandel, go ahead.
I meant to raise my hand first. We did approve number 2. Are we, because we have no changes, are we approving number 4 then?
I think we are going to, yes, I believe that's true. We will approve all of them collectively at the end, is my understanding. Okay, so that has been, number 2 has been changed, so that is part of the conditions now, and we'll go one by one. But if there are no changes to number 4, I think we can proceed. Okay, Ms. Kruger, I see that your hand is raised.
Thank you, Madam Chair, and I apologize if this is an inappropriate method for me to step in, but the neighborhood safety review that's a part of number 4 is a complete different item than the security plan. This is to be a meeting and people to get together, which we're not opposed to collectively talk about a plan for the neighborhood. But as written, number 4 requires this be completed before permit issuance. And this group getting together and creating this plan, again, we're willing to be a part of it, but delaying permit issuance for this plan to be completed is obviously of concern. So I just wanted to clarify the difference
Mr. Kruger.
between the neighborhood safety review and the security plan. Thank you.
Ms. Kruger, I appreciate that. My expectation is that the CAP board, along with the county and M House Fairview, could make that happen on Monday. Mr. Mandel?
Madam Chair, this document is not the same as the qualifier in I believe it was number 8. No, I'm sorry. This document was intended, as was the on-site security, to be reviewed by CAP board staff in a timely way. If the neighborhood, if we want the neighborhood involved in that, I mean, we don't have one yet. The I think the qualifier, if I'm looking, yeah, at the end of number 8, that's the meeting of stakeholders before the opening of the shelter, but it can be after the issuance of the permit. The very last line on number 8 references a meeting of the stakeholder group. That is not attached to the neighborhood security. Those are 2 separate things. But then it's basically, if the county would submit what they are intending to do with regard, this is to address the spillover issue, what they can and cannot commit to with regard to neighboring streets, et cetera, in the way of security. Am I making myself clear on that?
So, Mr. Mandel, when does that meeting need to occur?
Madam
Go ahead, Peter.
Yeah, Mr. Musty.
Madam Chair and Paul, thank you. We have begun that mechanism. The St. Paul Police Department Crime Prevention Unit, Patty Lammers, and Commander Ellison have been working, both of them have been working on research and have done an analysis of the district and have already filed some notes with us. We have a provisional meeting scheduled based on if there's approval with not with the neighborhood group, but with Capitol Security, with St. Paul Police tomorrow morning at early in the morning. So it's already underway, and the documentation is being developed. And I don't believe that would be a holdup to have that completed. It is not a plan. It is simply a review of the baseline so that we understand the issues going forward.
Thank you, Mr. Musty. That's super helpful. So that is not a delay in the issuance.
No, if you're asking,
yes,
no,
I'm asking. I'm sorry.
I do not believe that will be a delay in issuance of the permit.
Thank you. Representative Dean. Okay, so I think we can move forward, and the point of concern will continue on with regards to the meeting within condition number 8. So let's move on, if we can, to condition number 6. And Representative Hertaus, I'm going to hand it over to you as you raise some concerns about this particular number.
Thank you, Madam Chair. And could somebody clarify for me a better description? I'm trying to see it on the site plan. The private garden, is that garden fenced, or is it generally accessible or available to anybody who's walking in the area?
Madam Chair.
Yes, Mr. Mandel.
That's the green space. There are fenced areas that have enclosures, so to speak, but it's open to the public. It's the green space between bordered by Charles, Cedar, the building itself, and Como. There is a gazebo in the center of it that has been used by numerous parties, including the neighborhood at times through a rental agreement. That the gazebo is where there is a sign, and our desire was to see signs posted on the periphery too, so that everyone is aware of the rules of the greens. It's not a park. It's owned by Fairview, developed by Fairview, or by Health Partners previously.
Okay. Well, thank you for that explanation. We had clarified in past legislation a few years ago, there was not clarity and not uniformity with regard to the Capitol complex and the grounds line within the jurisdiction or the boundaries of the Capitol complex. So the one recommendation I would like to make under number 6 would be to the rules for the garden, including, and it says including prohibition of alcohol, but I would like, with regard to firearms, having that clarified, the illegal carrying of firearms. So people who possess, conceal and carry, lawfully possess a carry and conceal permit won't find themselves in trouble with the law and unknowingly by missing an obscure sign somewhere within the confines of that park area. So if we could clean that up to make sure that anybody who is legally carrying conceal and carry firearm would not be in violation of any regulation or law.
Thank you for that, Representative Hurtas. I would ask you, if you are going to do so, to make a specific motion to change that language, if that's what you would like to do.
Okay, so I will move that the that section in parentheses including prohibition of illegal carrying of firearms.
Okay, thank you for that. So that has been moved. Is there a second? I will second that motion, Representative Hurtas. Is there any discussion?
Madam Chair, Mr. Lenz.
Yes, Mr. Lenz.
I'm
sorry.
No.
I want to first go to Representative Dean, who had his hand raised, and then to Ted. I'm sorry.
That's okay.
Representative Dean.
That's okay. I'd let Ted go first. It's fine. But I would just add that, you know, as Health East is the ownership of this property, I believe within state statute, they have the ability to post a sign that they prohibit the carrying of all firearms, not just illegal. And by the way, carrying an illegal firearm is actually prohibited. So it's kind of redundant to add illegal carrying of firearms. I understand. I think I understand why Representative Hurtas wants that to be included. At the same time, I believe that the property has the ability to prohibit the carrying of firearms into the park. I could be wrong. I don't know the fine details of signage relative to facilities, but many facilities do have the ability to prohibit the carrying of firearms there. So
Representative Dean, you raise a good point. If you don't mind, I would like to call on our counsel from the Attorney General's office to weigh in here. Is that all right with you?
That would be great. Thank you, Madam Chair.
Thank you. Ms. Eller, could you please turn your camera on, introduce yourself for the CAP board and our listening and watching audience, and please advise on Representative Dean's question.
This is Christy Eller. I'm a special attorney advisor on the Attorney General staff and advising the CAP board on this particular issue. Representative Dean is correct if it is in fact private space, and I have to confess I am taking the staff of the CAP board's representations that it is in fact not public space. I don't know the answer to that from a technical property perspective, but if it is private space, then a private owner can make that determination.
Madam Chair, I guess the clarification for me, and I don't disagree with that interpretation or Representative Dean's comments, but is there clarification as to whether or not the public, Ramsey County, is leasing this space as part of their operation of this facility? That would make it quasi-public if the public is leasing this property.
For sure. I see Ms. Schmidt, did you want to weigh in here?
Thank you, Madam Chair. I can say that the lease that exists between Ramsey County and Health East, this is not part of the leased premises. It's part of the area that the county agreed between the parties to add security patrol to, but it is not part of the leased premises that will be under public control. It is private.
Thank you, Madam Chair. I'll withdraw my motion.
Thank you, Representative Hertaus. I appreciate it. Any additional concerns or changes to number 6? Let's see. Ms. Schmidt, did you mean to have your hand continue to be raised? Okay, it's gone. Mr. McLean, please go ahead.
Yeah, I don't really have a strong feeling about this, but I think someone raised it earlier. But and I get the desire for a sign with kind of rules and hours, but a sign, you know, prohibiting things that are already illegal. I guess, is that necessary? Does that just add some confusion?
Thank you for your comment, Mr. McLean. I think that we are okay. We will proceed as is written. I'm sorry, is there anything? Hold on one second.
Madam Chair, I believe as we are looking at 6 right now and we're talking about it, I think the question is, do we require these signs to be there? And I would actually move forward to make a motion to remove condition number 6 and make sure that as the neighborhood and the county continue ongoing conversations regarding the safety area, that be a critical part of that discussion about how the county is going to respond to those safety concerns, but making it part of the part of this conditional use just seems to be a bit of I don't want to use the word overkill, but a bit onerous on the county at this time. And I would hope that the Health East folks who are on this call realize that there's great concern about that particular space and that they should be offering to bring forward some signs to maybe outline some of these conditions. But making this as part of the conditional use for the county, I think might be a little bit difficult.
Representative Dean, are you moving to strike number 6?
Madam Chair, yes, I am.
Okay. Is there a second?
I'll second.
Okay. Mr. Lentz, was that you?
Yeah.
Okay. Is there any discussion on number 6? Senator Pappas, I see your hand raised, and Senator Nelson, I see your hand raised. Please go right ahead.
Madam Chair, thank you. I'll be brief. I really look at this as what we call in the legislature comfort language, that even though these things are illegal, it just gives a sense of comfort, I use that word again, to the community, and especially I think with the phone number being posted. So I think we should leave it in myself. I'm going to vote against the motion.
Thank you, Senator. Senator Nelson.
Thank you, Madam Chair. I agree. We must leave this language in here. It is comfort language, but we should clean it up. Specifically, the cleanup language might make it easier for others to accept, but we do need to post hours and include the prohibition of alcohol. When it comes to firearms, there are specific signage requirements if one is going to prohibit firearms in private buildings, and so that would have to be followed. And I do think it is redundant to prohibit illegal drugs. So I do believe that the sign should post hours and rules for the garden, including prohibition of alcohol. And I would add that I believe we should include what those hours are. I will just give you a little background. Some of my constituents have a new county park next to their properties, And they're so concerned because the park closes at dusk. There are no lights in the park, just like in this little park, there are no lights. But there continues to be congregating of groups of people in a park in the dark. They see a lot of drugs actually going in and out of that area, and they're very concerned. And so they are petitioning that the park be closed from dusk to dawn. And that's a typical thing that we do with a number of our parks. And I think it would be helpful here that the sign state that the park be closed from dusk to dawn.
No, I think that we're getting in the weeds now. Oops.
Well, I will not make the motion for dusk to dawn, but but I will definitely not support removal of the item 6 or 5 or whatever number it is now.
Thank you. Yep, number 6. Thank you. I want to go to Ms. Belton for additional discussion. Ms. Belton, please go ahead.
Thank you, Madam Chair. I would support keeping this language in, but modifying it. I don't oppose putting hours on there, and I like the idea of it being the comfort language. So maybe as part of the discussion where the community gets engaged with all the other staff to say, what can you do here? You know, as part of the comfort as opposed to what we can't do here. So, you know, here are the hours, but this is also a place for, you know, for gathering, for, you know, some positive things to kind of set the right tone.
Let's see, Representative Dean.
Thank you, Madam Chair. And I mean, this is probably the most concerning piece, because I agree with Senator Nelson and Senator Pappas and Ms. Belton that comfort language is important. It's really, really important. But this language is really kind of vague. It says signs, which I'm assuming means at the minimum 2. And given that there are entries all over different points on this park, where do you post them? So while I think this is all great intention and maybe it's vagueness that makes it viable, but I'm just concerned that this, you know, I mean, I'm not an attorney, but I know there are probably many attorneys that could look at this and say, you know, there are several aspects of this. Just 1, aren't enforceable, or 2, Fairview and the service providers could be sued over. So I just have some little concerns about the exact language, and that's why I thought we should take it out.
You are not an attorney, but we have some standing by to help architects, Mr. Dean. So with that, Christy Eller, I'm wondering if you could weigh in here briefly.
Yes, we could wordsmith some of the language. It really depends on what it is that the board wants in terms of language. Do they want, as I recall, there's some fenced areas around the park. Do they want to say, we want it the signs posted by the gazebo? I think there are places where there's fencing, you know, on each side. It depends on what the board wants.
Thank you for that. Mr. McLean.
Oh, sorry, this is probably inconsequential, but just because we've been staring at this for a little bit, I noticed that it starts with Fairview, and elsewhere in the document we say M Health Fairview. So I just want to flag that for consistency. I'm not sure that it matters, but if we keep that one, we might want to fix that.
I appreciate that. Representative, I think you are correct, and so if we can just note that. Representative Hertaus. And then I'm going to call the question in a minute.
I think maybe a compromise of Representative Dean's proposal and those who don't want to strike it to just leave it at the end of the first sentence, and then that is all that needs to be said. I think it's up to the owner and the users of the property to take it from there. But I think it clearly sets out that the signs will be posted for the use of the garden and passive spaces, and just end it there.
Madam Chair, I would accept that, and I think that would take care of my concerns.
Great. I want to make sure that we hear from Ms. Belton, and then I'm going to call the question here.
I would support that as well. Leaving it at the end of the on-site, that's sufficient for me.
Representative Dean, would you mind withdrawing your motion and then making a new motion with that language?
If that's procedurally what we need to do, I would be happy to withdraw my motion and make a second motion to end condition 6 through the period of the first sentence.
Can I offer a friendly amendment to your motion to add M to the front of Fairview?
Oh, yes,
M
of course.
Fairview.
Of course, Madam Chair.
Thank you.
And I'll second the motion.
Thank you, Mr. Lenz. Good times. All right, we're going to go ahead and vote on the motion that is before us. You can see the language, and I will go alphabetically through the list of which you are all so familiar. Dr. Bean.
Aye.
And as I'm going through here, sorry. Alicia Belton.
Aye.
Representative Dean.
Aye.
Ms. Fink.
Aye.
Mr. Grundhauser. Mr. Grundhauser. Representative Hertaus.
Representative Dean, thank you. Aye.
Mr. Lenz.
Aye.
Mr. McLean.
Aye.
Senator Nelson. Senator Nelson.
Senator Nelson votes yes.
Thank you. Senator Pappas.
Yes.
Mr. Yang.
Aye.
And I, Chair Flanagan, vote aye. So that passes?
Madam Chair,
Yes.
Paul here.
Hi, Paul.
My participant list shows that we have lost Mr. Grunhauser. I don't know whether his computer died out or what happened, but we don't have him on the list anymore.
Okay, thank you. I appreciate that. I would ask if you can just reach out to him and check in. I would appreciate that. So that motion passes. We are now moving on to number 7, the operations plan. If you have a question or comment that you would like to offer here, please go ahead and raise your hand. Okay, I'm going to move right along. Oh, okay.
Sorry. Sorry, just a quick question about, has this plan already been submitted? So that again, there's not going to be any delay for the opening next week.
Mr. Mandel.
Madam Chair, the plan has been received. That's the one that's 50 pages. I haven't begun to open it.
Okay, thank you.
Any additional questions or comments here? All right, moving on to number 8. I know that there are folks who have some suggestions here, so if you could please raise your hand and I will call on you for any contributions to this particular number. Senator Nelson.
Thank you, Madam Chair. I think this is where one of the things to include, or maybe it's that let the community ask, is this a distinction between increases in level 1 and level 2 crimes?
As part of the meetings, okay. Is Representative Dean, did you have a comment here?
Well, I was just going to say, thank you, Madam Chair, that I think this is also where what Senator Nelson brings up is this notion of reporting to the community what are the incidences. So I think some language that speaks to that would be good. When I read the second to last sentence, it says the first meeting will occur before the opening date of the shelter, which I think is good. And it doesn't prohibit the issuing of the permits prior to the first meeting. it will allow that meeting to transpire between the permitting and the actual occupation of the shelter.
Thank you. And I think that we can put some language in here that suggests that the first meeting occurs on Monday. I will hold on to that for just a second, as I know that there is additional comments to be made here. Senator Pappas.
I think you answered my question. Again, I don't want to delay the opening, which I think is scheduled for the 22nd.
Great. And then, so two things here. Senator Nelson, I want to come back to you and see if you wanted to explicitly add the language of Tier 1 and Tier 2.
Thank you, Madam Chair. Yes, I do, because I found it troubling that the presentation today simply said that Tier 1 offenses, there had been no increase in Tier 1 offenses. And that is really not giving a community the picture that it needs. Level 2 or Tier 2 offenses are more common. And I think it's important that those be looked at as statistics are given out. And also, Level 1 offenses, some of them now have been moved down to Level 2 offenses. So I think it's an important piece that should be there for the communities so that they can ask for that, and also that we will know going forward as well if there's an extension someplace, some other time, we need to have those numbers so we know. And so I would ask, and that means those numbers have to be collected. And I do believe the St. Paul Police Department does collect those numbers. It's just a matter of transparency and reporting them.
Excellent. Mr. Mandel, I see your hand raised. Can you give us some advice here?
Yes, Madam Chair. The St. Paul Police currently attends the block club meetings on a monthly basis, as does someone from the CAAPB staff, and they do report statistics and such. My suggestion, if Senator Nelson wanted to add that language, would be in the third to last sentence where it says meetings will be monthly through May 20 meetings, and then amend that sentence to include reference to including reporting of Tier 1 and Tier 2 crimes or something like to that effect.
Yes, thank you. I think that will make sure that that is data that is collected.
So Senator Nelson, are you making that motion?
Yes, I will make that motion, Madam Chair.
Thank you. Is there a second?
Second.
There's a motion and a second. Any discussion? Seeing none, I'm going to go ahead and call that vote. So there's a motion to change the language to say, it's in red before you on the screen. We will go one by one. I am inclined to vote in support of this motion. Dr. Bean, how do you vote?
Aye.
Ms. Belton, how do you vote?
Aye.
Representative Dean?
Aye.
Ms. Fink?
Aye.
Mr. Grundhauser? I don't know who's back with us. Okay. Representative Hertas? Representative Hertas? Mr. Lentz?
Aye.
Mr. McLean?
Aye.
Senator Nelson?
Aye.
Senator Pappas?
Yes.
Mr. Yang?
Aye.
And I, Chair Flanagan, vote in favor. So that motion passes.
You can record her toss as an aye. My mic, couldn't find my mic.
Oh, no problem. All right, Senator Hertas, it is noted that you are also an aye. So that is unanimous for the members who are currently participating in the meeting. Thank you.
I'm representative and not senator.
Sorry, I didn't mean to demean you, As a House-trained Lieutenant Governor, I get to make that joke. Okay, so with that, is there any other additions? I may actually make a motion if that is all right with folks, and the purview of the chair, that the meeting, the first meeting would occur on Monday, December 22nd. On Monday, December 21st. So I am making that motion. Is there a second?
I'll second it, Alicia Belton.
Thank you, Ms. Belton. Is there any discussion? Senator Nelson, I see your hand is raised. Now it is gone. Any discussion? Senator Pappas, go right ahead.
Madam Chair, I would just say that rather than having a separate vote, I think this could be incorporated into the original motion, just to save us the time.
Madam Chair, I believe we've already voted on the first motion, so I think we need to take it up as the second motion.
Sorry, everybody. But I appreciate that. Thank you. So we'll go ahead and add that language. Okay, so we can just make I believe we can just make the change here and then vote on it collectively at the end. Christy, I'm looking to you. Is that all right?
Yes.
Ms. Miller? Okay, excellent. So moving right along, I believe that is it for the current conditions. Are there any additional pieces? Senator Pappas? I think we made it, but I want to make sure that if there are any additional conditions, that we are open to that now. Mr. McLean.
Oh, sorry. I just wanted to make sure that, is it supposed to be 2021 or 2020? I saw there was a comment on that. It's a good catch.
Mr. McLean, I appreciate your ability to continue to edit on the fly. We are grateful to you. Emmett has made that change. Okay, so, all right, everybody. I think we're there. Knock on wood here. Ms. Eller, you have your hand is raised.
Hopefully I have my microphone on. It's when you make a motion on all of the conditions, make clear that you catch that all the changes that have been made, because there wasn't a vote, for example, on the correction of the date. So.
Thank you, Ms. Eller. I appreciate that. Senator Nelson, I see your hand is raised.
Just briefly, Madam Chair, before we vote, I just want to make a one thank you and a couple brief comments. One, I want to thank the St. Paul officer, Mr. Ellison, Officer Ellison, who did send out the definitions between crime 1 and crime 2. And I just want to note that part 2, those definitions that were not included when the county official said, there's been no uptick in crime 1. But listen to what crime 2 is: vandalism, weapons, prostitution, commercialized vice, drug abuse violations. Those are the very type of things that could be most that are important to know. So I want to thank the committee for amending section 8 to include that very important distinction. And then my comments are, we've had a long afternoon here. I appreciate the chair's patience as we worked through all of these things, and I think we have a better product. But I want to just say how disappointed I am that once again, the CAAPB board has been crammed and jammed up here by Ramsey County. I know these are sticky issues, and I'm glad we've got this so that this will not happen again. But the fact that we got over 80 pages of documents, necessary documents, which have not even been able to be reviewed yet by outside counsel, is problematic. And I'm going to be voting for the CUP restrictions here because the variance passed. But I don't think we set a good stage here today when we are voting on things that have not been reviewed by outside counsel. I hope that we do not get put in that situation again. And so I just wanted to put that out there. We should not be voting on things that have not had outside counsel review. So thank you very much for your time, committee and Madam Chair.
Thank you for your comments, Senator Nelson. I appreciate that. And I think we find ourselves in very challenging times and the need to respond quickly. But I share your concern about needing to have a full review of the items that come before us. And I would just say, who knew that the CAP board would be such a hot a bed of hot topics coming forward in 2020, but that is where we find ourselves. So I appreciate your comments, Senator. Thank you. So with that, we are here. Thank you for all of these insights and key considerations. It is clear that I do believe that we have a better product now because people have been able to weigh in. If there aren't any additional comments or questions, we're going to move to a vote on the conditional use permit. As a reminder, these conditions, these are the conditions that will require continuous engagement between the co-applicants and the community. CAP board staff will continue to monitor this engagement and will provide updates with any key developments. Like with the variance, staff will pull up the motion language on the screen. And if you are going to make a motion, please refer to the language on the screen. As our attorney is advising, if you could also explicitly name that the changes that have been brought up, including the language on the screen, I would appreciate that. So is there a motion to approve the conditional use permit with the conditions we have discussed and with the changes we have incorporated on the screen?
I so move.
Thank you, Mr. Lentz. Is there a second?
I second it. Elaine Fink.
Thank you, Ms. Fink. Is there any discussion? Representative Dean.
Thank you, Madam Chair. So I'm looking at our final board approval, and it does not state anything relative to the change of conditions as agreed upon by the board in our meeting. And I don't know if we need to include this as for board approval, or we just need to state that that's what we're voting on is the amended 8 conditions put forward before the board.
Thank you, thank you, Representative Dean. We do need to include that in Ms. Spore. I would ask that you make those changes to the document. Yes, Mr. Mandel.
I call your attention to the second bullet, which notes with the amendments recorded during the board meeting.
Okay, thank you. Senator Nelson, you have your hand up. I just want to double check and see if you had anything else you wanted to add to the discussion.
No, Madam Chair. Thank you for checking.
Thank you. You bet. Okay, so I believe that we are ready to go as we've made those changes, and thank you, Paul, for that. So I am going to go ahead and we are going to call the vote here on the conditional use permit as the conditional use permit as proposed in the memo with the changes that have been made. So with that, we will call the vote. Dr. Bean.
Aye.
Ms. Belton.
Aye.
Representative Dean.
Aye.
Ms. Fink.
Aye.
Mr. Grundhauser. Representative Hertaus.
No.
Mr. Lentz.
Yes.
Mr. McLean.
Aye.
Senator Nelson.
Yes.
Senator Pappas.
Yes.
Mr. Yang.
Aye.
And I, Chair Flanagan, vote aye. So we have 10 ayes and 1 nay. The conditional use permit is granted with the conditions outlined in our discussion. Thank you for that robust conversation. So we have just two more things here that I want to get to. Thank you so much for everyone who presented today. Thank you to Ramsey County and to mHealth Fairview for the time you spent articulating the need for additional shelter and your plan to provide it. I appreciate it. And thank you to the members of the community who provided written and verbal input. Your input has been really important to our conversation and consideration of the proposal for the Bethesda site. The next meeting of the CAAPB board will take place in 2021, and staff will follow up with more information in the coming weeks. The last item of business here that I wanted to speak to is that Representative Dean, this is Representative Dean's last meeting with the CAAPB board, and Representative Dean has been a legislative appointee to the board, and we appreciate his service. You have been insightful, architecturally minded, and a really essential part of our conversation and our work here over the last few years. And I have to say, if I can just say personally, it has been really wonderful for us to be able to continue to connect in this space since we no longer serve together in the House. I want you to not be a stranger and to please weigh in whenever you desire on the issues that are facing the CAAPB board. And I also just want to say that I appreciate, I know that you had your last session just a few days ago, and I just wanted to tell you how grateful I am for you consistently being a voice for justice and ensuring that people who are often marginalized or who go unheard have a voice with you. And that is your vocation. And I know that that will happen regardless of where you continue to serve in our great state. So thank you so much for your service. And I would just ask you if you had any additional comments that you'd like to share with the CAAPB board.
Just real brief, because we're going on 4 hours here, and probably the longest CAAPB board meeting I've ever been engaged in. What a way to go out, but it's truly been a pleasure to serve on this board. The work of the CAAPB board is really, really critical to not only the Capitol grounds, the areas around it, but I think it sort of sets a tone on an area where oftentimes, you know, different sides and polarization sort of take the sort of attention as to what happens. And this is a board that I think that's able to overcome that. If people just look at our meeting today, we had some agreements and some disagreements, and we figured out a way to work through that. And you know, I think that speaks to the level of the individuals that are able to participate on this board. And since we, you know, today did something that I don't think any of us would consider an ideal way of dealing with the situation, but the current situation sort of, you know, required us to do that, and that's hard. I would just end to the residents in the area of the Bethesda site and where the shelter would be, please, please continue to be engaged. Your engagement is going to be critical to not only trying to address some of those negative impacts that it may have on your neighborhood, but I also think it's going to be really critical for those individuals that will be, you know, sheltered here, because ultimately those individuals are critical people. Far too often we see an otherization of those individuals who are very different than us. But I think that knowing some of the people I know in that neighborhood, I know that you all will do well to make sure that this project meets the success that I hope that we all hope that it will meet. So it's been a pleasure. I'm going to miss it, but I know that you all will continue to do great things. So thank all of you.
Thank you so much, Representative Dean. We appreciate you. And again, do not hesitate in sharing your expertise and perspective with us. Paul, could you please very briefly update us on the status of the term for 2021?
Yes, Madam Chair, first of all, I'd like to thank Representative Dean too for being critically essential on advancing the Nellie Stone Johnson statue through the design process, along with Board Member Elaine Fink. Representative Dean's logic at the critical time during the jury was critical to the process, and we are moving forward on that. I do want to inform, and I've informed most of you individually, but the legislators on this board, both senators and representatives, need to either be reappointed or replaced. I am in the process of issuing a letter to the Speaker of the House and to the President of the Senate requesting that, copied to the Lieutenant Governor. Sometimes it takes months for them to act. Hopefully you will at least put your name in if you're wanting to be reappointed. In addition, Mr. Lentz, your term is up. So the mayor, I believe, is soliciting interested names. If you wish to reapply, you would have to do so yourself. And Alicia Belton, as a gubernatorial appointee, is up. I was reminding her today that she was just like one board meeting ago, which was more than 4 hours ago, named to the executive committee. So hopefully she will reapply. That's a gubernatorial appointment that goes to the Secretary of State. So those, in effect, 6 members' terms are up and needing to reapply. Thank you, Madam Chair.
Thank you, Paul, and we will absolutely follow up with additional information for everyone and look forward to our additional conversations. The last thing that I would just say here, I know that this was a long meeting, but it was a meeting that was of critical importance to our work, but also, you know, as someone who comes from a community where Native people are 27 times more likely to be unsheltered. This issue is very personal for me and our relatives, and I call them our relatives, who are sleeping outside or finding themselves without shelter, sometimes get caught up in the day-to-day policy decisions and remain nameless or faceless, but they are human beings, much like the people who have been impacted and affected by COVID-19 directly. I believe many of these individuals have been impacted through several issues that have happened that many times are outside of their control. And so I appreciate the thoughtfulness, the compassion, the creativity from Hennepin County in stepping up, and also the willingness of neighbors to welcome folks in who are experiencing incredible challenges right now. We will get through this pandemic. We will come out on the other side, and we have the opportunity to do so, to come out on the other side with more compassion and humanity in our hearts. And I am eager to do that work with you on the CAAPB board, but also just as a Minnesotan. So Chi-miigwech, thank you so much for your time today, for your thoughtfulness, for your questions, and hope that all of you have a safe and happy and healthy holiday and new year. And with that, we are adjourned. Thank you.